I was Friday.
Good morning, Excellencies, ladies and gentlemen. Welcome back to this chamber. And you are kindly requested to take your seats. I call to order the interactive multi-stakeholder hearing as part of the preparatory process for the high-level meeting on pandemic preparedness, prevention and response. Just as yesterday, I can state again that I very seldom see this room so much packed, so much full. Thank you very much indeed for making it to New York. Thank you much indeed for your dedicated work, and thank you much indeed for your knowledge invested into this process. It will be greatly appreciated by the member states, and through the member states by 8 billion people out there. This meeting is held in accordance with Resolution 77/275 of February 24th, 2023. I warmly welcome you all here. This interactive hearing will offer an opportunity for all relevant stakeholders to exchange views on these dimensions of pandemic preparedness, prevention and response, on urgent actions and investments needed in and by all sectors, in pandemic prevention, preparedness and response, provide a key opportunity to identify how the political declaration of the high-level meeting can provide political support to the process underway in Geneva, and bring focus to the multi-sectoral nature of pandemics and the need to galvanize a whole-of-government and whole-of-society approach which will contribute to accelerating progress towards achievements of the Sustainable Development Goals by 2030. Ladies and gentlemen, with your permission, I would like to make some remarks of my own. Dear co-chair, Mr. Joy Fumafi, Executive Director of WHO, Mr. Michael Ryan, Excellencies, dear colleagues and friends, and warm welcome to you all on behalf of the Office of the President and myself at this occasion. We meet quite literally at a moment of inflection. On Friday, WHO declared the COVID-19 pandemic over, allowing us all to breathe a collective sigh of relief. But it is also a moment of deep reflection. This long-awaited news comes 3 years after the deadliest public health threats in modern history ripped across the globe, taking many millions of lives and ruining many gains built over the decades. It should not be forgotten how close we got to the total disruption of our lives, with so many to mourn for, children left without education, families without income, and our parents suffering alone. Economies grounded, supply chains interrupted, labor markets destabilized, public trust shattered, and stability undermined. A form of heritage is the unprecedented level of sovereign debts across the globe. Ladies and gentlemen, it was a real introduction to the prototype of the Anthropocene era crisis. Its consequences are still here with us. While the darkest days have passed, the questions just continue to linger. When will the next pandemic break out? Where and how will it hit humanity? What can we do to prevent it? And how should we ensure that it causes the least possible damage to our societies? Before I go any further, let me take this opportunity to make it clear why we are here today. This meeting is mandated to prepare for the high-level meeting on pandemic prevention, preparedness, and response in September in New York. It is a separate from the ongoing legally binding processes which take place in Geneva under the auspices of the international negotiating body. We in New York should complement the process, that process actually, with a focus on a multi-sectoral nature of pandemics. In fact, there are more than 250 participants here today who will speak, and that speaks volumes about the importance you place in finding the answers. Many of you were in the front lines during the worst chapters of COVID crisis. You were caring for huge numbers of people, leading breakthroughs in science, organizing medical supplies, providing real-time public information, representing community needs, and mobilizing funds. It is thanks to your heroism that our world is emerging more resilient today. But it is only one part of our global story. Other pages are filled with unheeded warnings, empty supply shelves, populations neglected, vaccines hoarded or thrown in the garbage. We must address the serious shortcomings in our national, regional, and global efforts to prevent another pandemic from taking a similar toll. As science journalist Ed Young wrote, normal led to this. To avert future crises, we should honestly assess every attended weakness. We must also make urgent investments, both financial and political, to guarantee that we never again face tragic shortfalls in solidarity. Because it was creepy and sad to see how quickly COVID nationalism became rampant among most of us. In short, we have to significantly change our response strategies. Indeed, COVID has taught us that PPPR goes beyond health. The pandemic has laid a charge on us to follow a multidimensional, whole-of-government and whole-of-society approach. Such an approach must target all of the social, economic, political, and environmental determinants. Last but not least, we must recognize that it became obvious that the health of people is intertwined with the health of animals, plants, and our shared environment. Dear colleagues, ladies and gentlemen, we know that the next pandemic, yet of unknowing timing, type, size, and impact, is approaching. It is a deadly race against time that we must win. Your help is critical. You have heard me saying time and again, governments do not have a monopoly on good ideas. Today, member states would like to hear from you. Your experience and perspectives will be highly appreciated. Thank you very much. I now invite members to view a pre-recorded statements by Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, to make a statement.
Your Excellency Chaba Koroshi, President of the General Assembly, Your Excellency Ambassador Omar Hilal, Permanent Representative of Morocco, Your Excellency Ambassador Gilad Erdan, Permanent Representative of Israel, Excellencies, dear colleagues and friends. Good morning, and I apologize that I cannot be with you in person. I have the honor to make these remarks on behalf of Secretary General Antonio Guterres and on my own behalf. I thank Your Excellency, the President of the General Assembly, as well as Israel and Morocco, for hosting this important discussion as we prepare for the high-level meeting on pandemic preparedness and response. As you know, on Friday, I declared an end to COVID-19 as a public health emergency of international concern. Over the past 3 years, COVID-19 has caused us all great suffering and taught us many painful lessons. We owe it to those we have lost to learn those lessons and to transform that suffering into meaningful and lasting change. COVID-19 may be over as a global health emergency, but the threat of another pathogen emerging with even deadlier potential remains. And pandemics are far from the only threat we face. In a world of overlapping and converging crises, an effective architecture for health emergency preparedness and response must address emergencies of all kinds. Based on an analysis of the multiple reviews of the global response to COVID-19 and more than 300 recommendations, WHO has proposed to our member states a framework for action for stronger governance, stronger financing, stronger systems and tools, and a stronger WHO at the center of the global health architecture. Already, WHO, our member states, and our partners are taking several of these actions forward. To enhance financing, a new pandemic fund has been established at the World Bank with technical leadership from WHO. The initial call for proposals has generated high interest from member states. To enhance accountability, member states are piloting the Universal Health and Preparedness Review, a new peer review mechanism. To enhance monitoring, WHO and the World Bank established the Global Preparedness Monitoring Board. To enhance systems and tools, we're working on various initiatives across 5 core areas: collaborative surveillance, community protection, safe and scalable clinical care, access to countermeasures, and emergency coordination. To enhance governance, member states are negotiating amendments to the international health regulations to make them fit for purpose. And to enhance international cooperation, member states are negotiating a new pandemic accord, a generational commitment that we will not go back to the old cycle of panic and neglect that left our world vulnerable, but move forward with a shared commitment to meet shared threats with a shared response. WHO also supports the proposal for a Health Threats Council as a forum for high-level political leadership. It's essential that such a council is grounded in WHO's constitutional mandate and complements and strengthens existing governance structures, including the World Health Assembly and the Standing Committee on Health, Emergency Prevention, Preparedness and Response, which WHO's Executive Board established last year. On one hand, we face the risk of failing to learn the lessons of the pandemic and perpetuating the cycle of panic and neglect. On the other, we face the risk of establishing multiple disconnected initiatives that drive further fragmentation. As we recover from the collective trauma of COVID-19, we must work together to build a new future that's equitable, inclusive, and coherent. This year's high-level meeting is a valuable opportunity for leaders to chart a clear path forward towards the future and a safer world. I would like to take this opportunity to thank former President Ellen Sirleaf, former Prime Minister Helen Clark, the co-chairs of IPPPR, and all the panel members for their valuable contributions. Thank you, and I look forward to seeing you all in New York in September.
I thank the Director General of the WHO for his statement. And now I invite Ms. Joy Fumafi, co-chair of the Global Preparedness Monitoring Board, to make a statement.
Your Excellency, President of the General Assembly, Ambassadors Umar Hilal and Ambassadors Gilad Eden, co-conveners of the high-level meeting, WHO Executive Director, Dr. Ryan, Your Excellencies, colleagues and friends, the global failure to prevent, to prepare for, and to respond to COVID-19 shows the price of neglect, counted in millions of lives lost, societies upended, and economies devastated. And as the President of the General Assembly says, we cannot let this happen again. The next 12 months are critical to building sustained political commitment to strengthen pandemic prevention, preparedness, and response, and missing this opportunity would be catastrophic for the world because the next pandemic is coming. This high-level meeting is a unique chance to work at the highest and broadest levels to correct our course. This is a watershed moment, an opportunity to generate real momentum and to drive the reforms needed to build a safer world. Despite the many divisions in our world, there is much we agree on. We agree on the need for greater equity, coherence, leadership, and accountability. There's a remarkable level of alignment in the many proposals for strengthening pandemic prevention, preparedness, and response. The question isn't just what we need to do, but how should we achieve it? Therefore, the need for monitoring and accountability to ensure that we not only uncover the core gaps and challenges, but also identify the most impactful actions that enable leaders and relevant actors to prioritize required efforts and take the evidence-based action necessary is evident. We must agree on how to achieve sustainable equity. We must ensure that life-saving countermeasures are available to those who need them, removing barriers to access and agreeing on a way to finance them. This will require addressing thorny issues of trade, of intellectual property. We must agree on how to work effectively together across sectors, across stakeholders. Leaders and representatives from all sectors and levels of society must build multi-sectoral preparedness, complementing health-focused reforms at WHO, including negotiations on the Pandemic Accord and on the IHR amendments. The purpose of monitoring is to provide regular, timely feedback on implementation of all this, in order to constantly identify areas that require improvement and make adjustments to ensure that we collectively all meet our intended outcomes. Monitoring enables us to strengthen stakeholder participation, to maintain relevance of actions, improve efficiency and effectiveness, ensure ownership and sustainability, address ethical considerations, and therefore ensure continuous improvements in our prevention, preparedness, and response. Today, I urge you to focus on the safe and common ground that we must all reach through this meeting. We need an equitable world in which all countries have the resources to protect their people and communities. We need a coherent world where our resources and efforts are coordinated effectively with all sectors and stakeholders enabled to play their role. We need an accountable world that has justified trust in its leaders because they demonstrate accountability for preparedness and prioritize the well-being of their people and all other people. Together, we need to build this world, and monitoring and accountability are essential building blocks. Pandemics connect us, and only by acting together with and for each other can we combat the existential threat that they pose. Thank you, Mr. President.
I thank the co-chair of the Global Preparedness Monitoring Board. Ladies and gentlemen, as indicated in the program, this interactive multi-stakeholder hearing also consists of 2 panel discussions and a closing segment. The first panel discussion, entitled Lessons Learned from the COVID-19 Pandemic, the Case for Pandemic Prevention, Preparedness and Response, will be moderated by Dr. Precious Matsoso, co-chair of the Intergovernmental Negotiating Body, and will take place immediately following this opening segment. The second panel, discussion, entitled Investing in Pandemic Prevention, Preparedness and Response, will be moderated by His Highness Prince Zayed bin Rad Al Hussein, President and CEO of the International Peace Institute, and will take place from 11:30 to 12:45. With thus, the closing segment would take place immediately thereafter. The opening segment is now concluded, and I would like to ask the moderator and the speakers of the first panel to come to take over the stage here.
Good morning. My name is Precious Matsuso. We have an opportunity during this public hearing for you as stakeholders to make meaningful contributions and provide inputs as part of the preparation for the high-level meeting. We have 4 panelists with me. Mr. Carlos Correa, Executive Director of the South Center, Ms. Cindy Kelemi, Executive Director of the Botswana Network on Ethics, Law and HIV, Bonella, Dr. Pamela Cipriano, President of the International Council of Nurses, and Ms. Himayal Sana, Liaison Officer to the World Health Organization, International Federation of Medical Students Association. We'll now begin panel discussions, one entitled Lessons Learned from the COVID-19 Pandemic, the Case for Pandemic Prevention, Preparedness, and Response. Before we start and before I give the floor to the panelists, I would like to have some housekeeping. For the participants who wish to speak during the interactive discussion, you are kindly requested to press the button located at the base of the microphone in order for you to be placed on the list of speakers. Representatives of the Secretariat will walk around the room to ascertain the organizations that wish to speak. I see they're already doing it. Once the name of your organization has been added to the list of the requests to speak, your microphone button will be deactivated. When the moderator invites the organization to take the floor, please press the microphone once. The green light on your microphone will guide the technician to activate your microphone. Once the light on your microphone turns red, indicating that your microphone has been activated, you may proceed to make your intervention. Participants may indicate their wish to speak starting now. They'll be called to speak after the presentation by panelists once the floor is open for the interactive discussion. We shall now hear from our panelists, and thereafter, the floor will be open for comments, observations, and questions. Panelists are reminded to stick to the time that they've been allocated, 3 minutes each. So I'd like to start by giving the floor to Dr. Carlos Correa.
Muchas gracias, doctora Matoso. Agradezco en nombre del South Center la invitación del presidente de la Asamblea General para participar en esta sesión. La pregunta central en este debate es cuáles son las lecciones del COVID-19, cuáles fueron los problemas que enfrentamos. El presidente de la Asamblea General ha hecho un excelente resumen de los efectos devastadores de COVID-19 en muchos de los países, en particular en países en desarrollo. Permítanme hacer algunas observaciones al respecto. En primer lugar, ha habido incluido por parte de la Asamblea General de Naciones Unidas declaraciones solemnes sobre cooperación y solidaridad en el momento más grave de la pandemia. Sin embargo, nada de eso garantizó la equidad. Los países en desarrollo perdieron vidas que se pudieron haber salvado. Los países en desarrollo perdieron años en sus logros en reducir la pobreza y en alcanzar los objetivos de desarrollo sostenible. La manifestación principal de la inequidad tuvo que ver con la distribución inequitativa de las vacunas. El mecanismo de COVAX fracasó en lograr una distribución equitativa de las vacunas, no solo por razones financieras, sino porque la gobernanza del sistema no fue una gobernanza multilateral. Por ejemplo, no se siguieron las recomendaciones de la Organización Mundial de la Salud en cuanto a una distribución equitativa de las vacunas. Esta falta de equidad se manifestó también en la rigidez del sistema de propiedad intelectual, en la negativa de las empresas de compartir sus tecnologías. La respuesta a la pandemia parece haber sido dominada más por ganancias privadas que por las necesidades de salud pública. También contribuyeron las políticas de algunos países de acaparar vacunas más allá de sus necesidades. Pareciera que el mensaje era: la vida o la salud de una persona en un país rico vale más que la vida o la salud de una persona en un país pobre. De cara al futuro, permítame hacer 4 observaciones. En primer lugar, es necesario formular un nuevo mecanismo para distribución de vacunas en forma equitativa. No se trata simplemente de retocar COVAX. Es necesario un mecanismo que tenga una efectiva base de gobernanza multilateral. En segundo lugar, es necesario un mecanismo para compartir informaciones clínicas, resultados de investigación, tecnologías, de manera de acelerar la aprobación de los nuevos productos y de expandir la oferta de vacunas de manera rápida. Es necesario, en tercer lugar, establecer un sistema de reparto de beneficios derivados del uso de información genética sobre los patógenos, de conformidad con el régimen internacional en materia de biodiversidad. En cuarto lugar, se debe lograr equidad en cuanto a las capacidades financieras, a la disponibilidad de recursos técnicos en los países. Este es un punto fundamental. Esas capacidades hoy son desiguales y un objetivo central de cualquier acción en esta materia debe ser lograr un mayor balance en las capacidades en términos financieros, en términos de capacidades técnicas para hacer frente a futuras pandemias. En suma, señores delegados, la equidad no solamente puede ser un principio retórico, como aparentemente lo ha sido. La equidad debe instrumentarse en cada una de las medidas que son necesarias para que la Organización Mundial de la Salud tenga, en una próxima pandemia, las herramientas que son necesarias para actuar de manera eficaz, esas herramientas que no tuvo durante la pandemia del COVID-19. Esperamos que la negociación del instrumento internacional sobre las pandemias y la revisión del reglamento internacional de salud puedan superar los obstáculos que se han enfrentado durante COVID-19, permitan remediar las enormes fallas que se han tenido. Esperamos también, por cierto, que la declaración política de alto nivel que se está preparando en esta casa pueda lograr los compromisos necesarios para que esos instrumentos sean efectivos. Muchas gracias, señora moderadora.
Thank you, Dr. Carlos Correa. I'd like to now invite Ms. Cindy Kelemi.
Thank you, Madam Moderator. Allow me, first of all, to acknowledge some of the partners that we have been working with in the pandemic preparedness work. I want to acknowledge the Botswana Council for Non-Governmental Organizations, which is based in Botswana. I also want to acknowledge Frontline AIDS, which is a partnership of over 60 civil society organizations working in over 100 countries. Having said that, Madam Chair, there are many lessons that we could discuss that we learned from COVID-19, but in the interest of time, allow me to focus on three key main ones. The first key point I would like to recommend for the political declaration is that language on political support and financing of existing community systems, services, and community workers needs to be included alongside references to more formal health systems and health workers. Pandemics begin in communities, and they are also responded to and ended in communities. We saw this during Ebola and COVID-19 as well. Community-led initiatives and actions are vital for resilient and sustainable PPR, reaching all of society, all of government, and One Health. This will enable trust within our communities with a clear, consistent, co-created messaging that supports information sharing and reliable communication. Many of us here present are safe today because community services and workers played a key role to mitigate the impact of COVID-19 in our communities by building on existing infrastructure and lessons that we have learned and perfected in the HIV response and in community system strengthening. The political declaration should commit to continue supporting human and financial resources for these ongoing pandemic and epidemic responses, including HIV, TB, malaria, COVID, and others, as the best base for strong health and community systems for effective and sustainable PPR. The second key point I would like to emphasize is that language on civil society and community leadership in the co-creation of national and global PPR decision-making needs to be included in the political declaration. Community leadership in co-creating and delivering community-led services is critical for people-centered, resilient, and sustainable PPR systems. Evidence demonstrates that it is not the biomedical measures that are most effective during pandemic outbreaks. What comes first at the time of the greatest emergency are mass measures that require cross-societal trust and in-depth knowledge of risk. Civil society and communities are the most powerful brokers when it comes to these cross-societal solutions. In particular, the political declaration needs to endorse community-led monitoring, tracking, and surveillance of pandemics. Civil society and communities also have a key role to play as human rights defenders. We know that the human rights and dignity of every person within PPPR is critical. Young girls and women should not be exposed again to unbearable levels of physical and sexual violence. Communities having power in the decision-making will know how to prevent this from happening again. Strong multi-stakeholder PPR fora representing the whole of society will make or break successful national responses to the future pandemics. Civil society and communities' official advisory role within this HLM and upcoming treaty negotiation is critical for successful global PPR processes, combating stigma and discrimination and creating an enabling legal environment. We must build on learnings from the HIV response and build on those structures and ensure that we use those same structures to respond to future pandemics. Efforts to prepare for future pandemics should harness this substantial expertise and experience that already exists and use it as a base for PPR. National, regional, and international efforts to prepare for the next pandemic need to prioritize dual purpose investments and build on top of existing disease programs instead of creating new silos. For all member states, the HLM political declaration should commit governments and international agencies to provide cross-disease training for health and community workers in order to leverage surveillance and detention. I thank you.
Thank you.
Detection.
I'd like to invite Pamela Cipriano.
Thank you very much. On behalf of the International Council of Nurses and the 28 million nurses worldwide, it's important that we reflect on the impact of the COVID-19 pandemic, not just on nursing care, but the entire healthcare workforce, and pay attention to the lessons that we've learned. While my comments will specifically mention nurses, it is really generalizable to the entire healthcare workforce and human resources for health. The pandemic exacted a huge toll on the physical and mental health of workers around the world, infecting millions and causing the deaths of more than 180,000. As a result, we're seeing alarmingly high levels of stress and burnout in nurses across the world. And this excessive burnout is coupled with the aging of the workforce and an already existing shortage of 6 million nurses, half of which are in our African nations. But we have seen projections that could be as high as 30 million shortage by the year 2030. Healthcare workers stepped up for COVID and put their lives on the line, but we have to ask, will they be there the next time? Every health system is suffering under workforce challenges right now. Now, nurses are also the foundation for UHC, as well as strong, equitable, and resilient health systems. We want policymakers, as well as national and local decision makers, to take decisive steps to build and optimize an enduring, strong, and sustainable workforce to advance UHC and effective pandemic prevention, preparedness, response, and recovery. The International Council of Nurses is calling on the political declaration to address the following. First, protection of and investment in the nursing profession to rebuild health systems that can deliver the SDGs and UHC. 2, ensure safe and healthy working conditions, fair and decent pay and benefits, and respecting nurses' rights. 3, strategies to finance needed positions, as well as recruit and retain nurses and workers to address the shortages. 4, development, implementation, and financing of the national workforce plans that are needed to attain self-sufficiency in the supply of nurses and workers. 5, investment in high-quality, accredited nursing education to prepare more nurses and advance career development. 6, reestablishing a priority focus of health systems on public health, primary care, health promotion and prevention, community, home-based, and patient-centered care. Involvement of nurses in decision-making affecting healthcare at all levels. 8, building local, national, and global multilateral partnership for action in all sectors. 9, protection of vulnerable populations, upholding and respecting human rights, gender equity, and social justice. And 10, appointment of nurse leaders to executive positions of all healthcare organizations and government policy-making bodies. The political declaration should be a unifying commitment that binds action from all sectors for PPPR as well as UHC and ending TB. Nurses are key to healthier communities, responsive societies, thriving economies, and powerful nations. Their expertise is vital to addressing everything from primary prevention to health emergencies. We must not forget their sacrifices during the pandemic, but instead, we need governments to value the contributions of nurses and others, elevate them to positions where they can more directly influence healthcare policies, and make sure that they never again have to face a deadly pandemic without the care, support, and protections that they deserve. Thank you.
Thank you. I'd now like to invite Hamiel Sana.
Thank you so much, Ms. Moderator. Your Excellencies and distinguished delegates, the COVID-19 pandemic exposed the underlying deficiencies across our global systems to protect the lives of vulnerable populations. The social, micro, and macroeconomic and health impacts of the pandemic support the need for urgent action to reform health delivery systems through multilateral partnership and commitment for pandemic prevention, preparedness, and response. This moment, with the announcement of the end for the global emergency status of the COVID-19 pandemic, presents as an opportunity for member states, international organizations, financial stakeholders, and all members of society to reflect on the needed actions from a wide scope, enabling parallel and cross-cutting initiatives that allows for efficient and sustainable preparedness, prevention, and response processes, and put concrete asks on the table ahead of the negotiation of the political declaration. These actions should be reflected on national, regional, and global levels and must be highlighted in the pandemic instrument to be developed, in addition to the proposed action and amendments directed towards strengthening the IHR. All these actions should fall under the umbrella of equity, diversity, and inclusion towards achieving health for all by all. As such, our first ask is to achieve this, we need to strengthen our health systems with special focus on strengthening the laboratory and surveillance systems to ensure stronger health information systems. This should be coupled with the capacity development and education of the health workforce and ensuring an increase in the quantity and quality of the human resources working towards the pandemic preparedness, prevention, and response. Secondly, allocation of sufficient and realistic budgets and financial resources for the pandemic processes is also required, alongside identifying unconventional means of fundraising for the technical support of the pandemic processes. In addition, countries' financial collaborations on regional and global levels, such as the Pandemic Fund, is necessary to secure the sustainable funding for countries to develop and implement their pandemic-related, regardless of their national economic situation plans. Global strategies and action plans should be adapted to national context, taking into consideration the social, economical, environmental, commercial, and political determinants of health. This should be done through a full process of design, implementation, M&E, that allows for the meaningful engagement of all sectors of the society with the inclusion of more vulnerable groups such as women, youth, older population, migrants and refugees, people living with disabilities, and forcefully displaced people with pre-existing health conditions. Lastly, the pandemic does not exist in a vacuum, but rather is very much interlinked with other issues. Therefore, it is important to support research on the interlinkages with the pandemic to identify entry points to support the pandemic processes. The IFMSA believes that the preparedness, prevention, and response to pandemics is essential to minimize the health, social, and economic impact of any crisis. Furthermore, we also highlight the importance of the continuous investment in strengthening health and public health systems that can detect and rapidly respond to any acute health incident. Pandemics cannot be handled by any single group, profession, or organization, but instead require nations with all sectors of the society, including youth, the future health professionals, to work together to efficiently and swiftly save as many lives as possible while minimizing the immediate and post-crisis impact. Thank you.
Thank you very much. We have now concluded our list of panelists. We're now going to open the floor for comments and questions. I would like to remind participants that once your name has been placed on the list being compiled by Secretariat, your microphone will be deactivated. The button will be deactivated. So please note that you do not have to keep pressing the button repeatedly. Only when I give the floor to a participant, I would then request the speaker to press the microphone button. That's the only time you're allowed to do it at that point. So the green light on your microphone will guide the technician to activate your microphone, and once the light on your microphone turns red, indicating that it has been activated, you may proceed and make your intervention. So in order to allow maximum participants, I've been very strict on my panelists. You probably saw me sending notes. So I would like you to get an opportunity to say your piece as well. So to allow maximum participation, I appeal that you limit your intervention to 2 minutes. So the timer has been installed on the screen to assist speakers to ensure there's time management. I now give the floor to IPPR Liu, Joanne Liu.
Good morning. My name is Dr. Joanne Liu. It's September 2014 here at the UN. I appeal for a global response to Ebola outbreak in West Africa. Médecins Sans Frontières Ebola Center was so overwhelmed, we barely could offer end of life of care. Help finally came. The UN Secretary General mobilized a coordinated multi-sectoral response. Presidents and prime ministers step in. This made the difference. The big lesson from Ebola, nothing happens without political leadership. I'm here representing the former co-chair of the independent panel, Ellen Clark, Ellen Johnson Sirleaf. The panel spent months studying the response to COVID. In order to create a system that works for everyone, one of our major recommendations was the UN GA high-level meeting and political declaration. Why? 3 main reasons. First, as the UNGA did for Ebola, we need the highest level of political attention on pandemic threats because they are overwhelming, complex, and have multi-sectoral impact. A leader-led Global Health Threat Council is essential to sustain global pandemic readiness. Second, 2 types of financing are required, one for preparedness and one for emergencies. COVID costs the world trillions. Leaders must commit a fraction of that to protect all countries. Third, leaders must solve the problem of how to ensure all countries have access to vaccine, tests, and treatment on time where they are needed. Essential to deliver the right to health, save lives, and stop outbreak. I know from experience, it is certain that new pandemic threats will emerge, but full-blown pandemics are a political choice. This September, the UNGA has opportunity, historical opportunity, to choose to make COVID-19 the last pandemic of such devastation. Thank you very much.
Thank you for setting the tone and keeping on time. Let's go to Women for Global Health.
Thank you. I'm speaking on behalf of Women in Global Health. The COVID-19 pandemic demonstrated the need to create and secure strong health systems at the national, regional, and global level. But health services do not deliver themselves. It is health workers, 70% of whom are women and who comprise 90% of frontline workers. Women health workers were severely mistreated during the pandemic, and reports show that many have left or are planning to leave their roles, adding to the great resignation, migration, and critical shortage of health workers. Therefore, we ask member states to consider these 5 asks. 1. Include a requirement that all decision-making bodies have a 50% representation of women members, including women health workers, with a particular focus on women representatives from the Global South. 2. Ensure all health workers receive personal protective equipment that is fit for purpose. 3. Ensure all health workers, especially women, receive fair and equal pay. 4. Put in place robust mechanisms to prevent and respond to sexual exploitation, abuse, and harassment against women and girls in health emergencies. And 5, we emphasize the need for gender-responsive health systems. This includes ensuring sexual and reproductive and maternal and child health services are maintained as essential health services during emergency situations. Finally, we align ourselves with a statement made by the International Council of Nurses during the panel. Thank you.
Thank you for giving us those seconds. They'll come handy. Global Health Center, Graduate Institute.
Thank you, Madam Chair. We are grateful for this opportunity to contribute to this important multi-stakeholder hearing. As an academic research institution focused on global health governance, we believe that it's crucial to ensure the representation of civil society in these decision-making processes. And we express our appreciation at this opportunity. We would like to emphasize 3 points. Firstly, we are at a critical moment with the upcoming deadline of May 2024. Strong political will, compromise, and commitment are needed. We hope that the high-level meeting will lead to continued political attention at the highest level to support and complement the ongoing processes in the WHO. We have a historical opportunity to ensure greater coherence and coordination across the UN system. at the national and international levels, and to address the fragmentation that currently exists in PPR. Secondly, we call for a holistic and ambitious approach to international rulemaking that considers the multi-sectoral nature of pandemics. While developing a new pandemic instrument, we need to look beyond the health sector to ensure that rules in other areas, such as environment, trade, intellectual property, migration, and travel regimes, are coherent with the health objectives and overarching principles. All PPR rules must also be grounded in respect for human rights. Finally, we urge all member states and stakeholders to prioritize and commit to adequate, reliable financing for PPR, with contributions appropriate to each country's level of economic development. Without this, the pandemic instrument and revised international health regulations risk being just words on a page. The high-level summit is an opportunity to realize these three imperatives: mobilizing political will, promoting a whole-of-society approach, and ensuring sufficient financing to make these words a reality. We cannot afford to waste this opportunity. Thank you.
Thank you. Rural Health Advocacy Project.
Thank you, Chair. I think my comments will be very brief. I think we know that healthcare needs are unlimited, but healthcare capacity to respond is very limited. And I think in that context, it's very important that we consider investing not just in the elements of governance, but the real participatory, transparent, and inclusionary processes to make decisions. We know now, as we exit probably a 3-year COVID pandemic, that we are facing a deep fiscal crisis, and governments around the world are faced with difficult choices. So as we prepare for the next pandemic, I think we need to strengthen local health systems by prioritizing the needs of those most likely to get left behind. In South Africa, officially 104,000 people lost their lives to COVID, but our excess deaths are almost 3 times that, suggesting that many people didn't even receive the access to COVID medication, vaccines, or treatment during the times of the pandemic. And I think it's essential that now, as we build back better, that we create the kind of mechanisms to ensure that we have these participatory governance processes that ensure answerability and involvement to ensure that no one gets left behind. Thank you.
Oh, thank you. Brazil. Brazil as a country, not NGO, right?
Thank you. I'd like to make an echo with Carlos Maria and add 3 points to this panel. First, it's in the zero declaration. You need to build the trust, but trust comes with transparency, and we need to assure that we have more transparency in data, in information, and the contract between government and industry by the price that we are paying for the technology that we are developing during the pandemic. The second one is regulation of misinformation. This is very important right now. We saw during the pandemic the impact that the misinformation making in the vaccine hesitancy. In Brazil, we have a very low hesitancy, less than 1%, but during the pandemic, this was increased for 11%, and this has impact for other vaccine too. So this is a very important point, and we need some regulation for our social media that has an impact in spread this misinformation. And finally, we need to work with the independent agency in our country. Right now, I'm part of the new government, but unfortunately, the older government in Brazil make a very bad situation in our pandemic response in Brazil, and because of that, we are right now with this hesitancy and all that thing that we need to rebuild in Brazil right now. So we think that we need to work with the independent agency. Thank you very much.
Thank you. Non-Communicable Disease Alliance.
The COVID-19 pandemic has and continues to demonstrate the need for greater political commitment, resources and focus on health as it underpins the social and economic well-being of all communities and countries. The COVID-19 pandemic has shown that the prevalence of underlying conditions such as non-communicable diseases, NCDs, increases the vulnerability of populations to pandemics. Some studies estimate that the mortality is as high as 60 to 90% of COVID-19 cases attributable to either one or more of these conditions. Given the indisputable links between NCDs and public health emergencies, people living with NCDs must be specifically identified as vulnerable populations and individuals or groups at high risk in all conversations related to the preparedness and response to the public health emergencies. As such, people living with NCDs must also be given the right to fully engage in prevention, preparedness, response and recovery of health systems, which are essential to mobilise social capital, resource, adherence to public health and social measures, and to gain trust in governments. To support accountability through strong monitoring and evaluation mechanisms, we also call for access to pandemic-related products and health services to be strengthened through the collection and use of existing medical conditions, gender, age and disability disaggregated data. Finally, countries must work towards achieving universal health coverage, as healthy populations and strong health systems will support resilience in the face of any future pandemic threat. Key to achieving UHC is to include and invest in quality NCD prevention and care services in country health benefit packages. Thank you.
Thank you. Columbia University Mailman School of Public Health.
Thank you, Madam Chair. Frontline health workers continue to be infected and die at higher rates, especially early in epidemics. While public health is politicized, frontline health workers rush in to save lives. The risks of caring are especially true for frontline nurses providing high-touch care. Nurses consistently have the highest levels of mortality amongst all health workers during the early epidemic phase. The statistics on the magnitude of this problem have now been well documented, from the 2014 to 16 West Africa Ebola outbreak to COVID-19. Unfortunately, there is a paucity of data on the transmission risks healthcare workers faced as the AIDS crisis raged in sub-Saharan Africa, where myself and thousands upon thousands of frontline healthcare workers worked without gloves, without masks, or sharps boxes. I am here on behalf of Mrs. Shiradza and all the nurses who have died fighting for the lives of their patients, whether HIV, Ebola, or COVID-19. I implore member states to hold themselves and each other accountable to develop specific, measurable, minimum standards that will rapidly improve healthcare worker unfettered access to essential PPE whenever and wherever it is needed. Basic measures must be in place to protect us, to be at the ready when the need arises. I implore member states to support innovation, to develop durable PPE to protect our front line of defense, our healthcare workers, whether the pathogen is known or a black swan. We know how humans are infected and we know how to protect them, but it is our human failure to ensure these protections are available. This is a problem we can solve without specific, measurable standards to which all member states are held accountable. Healthcare workers will continue to become ill and die when they are needed most. Please work with me to protect my fellow frontline healthcare workers. Thank you.
Thank you. Path.
On behalf of PATH, thank you for the opportunity to give input. We applaud the dedication to PPR and call on stakeholders to commit to abandoning the Band-Aid approach we've used in the past and instead chart a new path towards sustainability. This will require integrating pandemic preparedness and response within our primary healthcare systems, linking PHC with disease surveillance, laboratory diagnostics, and outbreak response efforts, to build resilient systems that can adapt to new threats and sustain comprehensive health services. Investment in health workers helps detect diseases in community settings, along with training epidemiologists, lab technicians, and other frontline providers. We must build out surveillance systems that can monitor and test for multiple diseases and emerging threats, and prioritize existing threats like antimicrobial resistance and incorporate AMR mitigation into preparedness planning. Clearer commitment to innovation through global coordination structures and financing to spur innovation at the outset of new pandemics to meet the 100-day mission will speed response. Investments are needed in regional health security and local production of medical countermeasures through strengthening clinical trials capacity, regulatory systems, and manufacturing capacity. These efforts must include stronger agreements that ensure innovations can be delivered rapidly and equitably to all who need them through strong health systems. Finally, the creation of the Pandemic Fund is a promising start, but success will depend on new donors coming to the table and existing donors committing more in much closer coordination while incentivizing domestic and private sector investment. The outcomes of this HLM will set the tone for acting on the lessons learned from this pandemic and ending the cycle of panic and neglect. Thank you.
Thank you. Private Sector Roundtable on Global Health Security.
I'm honored to represent my private sector colleagues on the Private Sector Roundtable on Global Health Security, the PSRT, which is a coalition of companies from diverse industries including healthcare, logistics, communications, technology, finance, and energy, who are all committed to strengthening global health security. Multi-sector engagement is a key lesson learned from the COVID-19 emergency and a core focus outlined in the draft resolution on PPPR. We urge that, 1, the September HLM has a strong representation from the private sector to help advance a whole-of-society approach for more effective PPPR and to accelerate progress towards achieving sustainable development goals. There are many areas where the public health response to a health emergency would be strengthened by engaging the business community before disaster strikes. We also urge that engagement of the private sector should be featured in the action-oriented political declaration that will be developed, which is referenced in Section 5 of the draft PPPR resolution. Specifically, member states should facilitate formal pathways to directly engage the private sector's distinct capabilities for health system resiliency. Private sector companies across the world leverage their expertise to strengthen health system resiliency through their support for building local capacity and developing human capital, from engagement and training on lab modernization, supply chain management, and distribution of vaccines, to analyzing and visualizing critical health data to inform countries' development of resources. On behalf of the members of the broader private sector, we wish to express our deepest gratitude to the esteemed President of the UN General Assembly and all of the participants here today for your willingness to collaborate with the private sector to help achieve a world safe and secure of global health threats. Thank you.
Thank you very much. Avak.
I'm sharing this intervention today, drawing on a statement endorsed by over 100 representatives across civil society and communities. Pandemic prevention, preparedness, and response must be informed by the key principles of equity, inclusivity, and human rights for all. We must learn from the HIV experience. We cannot make the same mistakes the world made at the outset of the HIV pandemic by neglecting to invest in community health systems, leadership, and engagement, refusing to share knowledge and transfer technological capability, and inequitably allocating and distributing life-saving medical technologies during acute health emergencies. We have learned at a great expense that engagement of communities at all levels is not a choice, it is a must. The political declaration must clearly commit to meaningful community engagement, especially of those most marginalized, as an integral part of the health system and global health governance. We have observed with extreme concern the unequal impacts of COVID-19. We know from over 40 years of experience in the HIV response that a global health system that prioritizes profits over human lives and well-being will continuously fail. We cannot afford to continue business as usual like this when the next pandemic strikes. Through this statement, we issue a call to action to member states to make strong, accountable commitments in the UN Declaration to enshrine equitable access to medical technologies as a baseline standard. Lastly, in response to pandemics, the response to pandemics is not only member states' responsibilities. Everyone must play their role, and civil society and communities have a role to play. We cannot succeed if everyone is not engaged. The political declaration must clearly outline member states' commitments to ensure baseline standards of meaningful work with communities and civil society. Thank you.
Thank you very much. Intra-Health International and Frontline Health Workers Coalition.
My name is David Bryden. I'm the director of the Frontline Health Workers Coalition and senior policy advisor at IntraHealth International. Director General Tedros has stated that the single largest cause of disrupted health services during the pandemic was the shortage of health workers. And the single largest barrier to deliver vaccines and other life-saving tools to combat COVID-19 was the shortage of health workers. Yet investment in the health workforce and the broader community health system has been inadequate despite the enormous return on investment in terms of economic progress and opportunities. In addition, migration of health workers, in particular nurses, from low and middle-income countries to high-income countries has increased dramatically in recent years, putting pandemic response capacity at risk in their countries of origin. All countries have a responsibility to implement the WHO Global Code of Practice on international recruitment of health personnel and ensure that bilateral migration agreements provide proportional benefit for both parties and protect migrant health workers. We must address also the 24% gender pay gap facing women health workers, the burden of unpaid care work, gender-based violence, and the fact that women account for almost 7 in 10 of all health and care workers but hold less than 1 in 4 senior positions. I urge member states to ensure strong commitments to strengthen and respect the rights of health workers in the political declaration of the high-level meeting on PPR. Thank you.
Thank you very much. Saudi Arabia.
سيدة الرئيسة، وإذا تجاوز العالم حالة الطوارئ المرتبطة بجائحة كوفيد-19 فإن من أهم الدروس المستفادة هي أن التعاون الدولي والتعاون متعدد القطاعات ضروريان للتصدي بفاعلية لحالات الطوارئ الصحية. لقد طورت بلادي نهجا متعددة القطاعات لدعم وبناء القدرات وتشجيع الاستثمارات لضمان الوقاية من الجائحة والتأهب والاستجابة وتعافي النظم الصحية. ونسقت بلادي جهودا متميزة على الصعيد الدولي المتعدد مع تخصيص الموارد المالية حتى لا يترك أحد متخلفا عن الركب. ونحن في هذه المرحلة الحاسمة من صياغة إعلان سياسي في هذا الموضوع الهام نرى أنه من المهم التركيز على تحسين التنسيق والدعم للبحث والتطوير أثناء الوباء وضمان التوفر المبكر والوصول الفعال والعادل للاختبارات واللقاحات والأدوية، وينبغي أن يتم ذلك بطريقة تتماشى مع الجهود الدولية دون أي ازدواجية في الموارد أو تدخل في آليات التمويل. ولتحقيق ذلك نحتاج إلى توصيات وخطط عمل واضحة على المستويات الدولية والإقليمية والوطنية لضمان التنفيذ السليم والفعال لمبادئ الوقاية من الجائحة والاستجابة لها. وشكرا.
Thank you, Saudi Arabia. Right to health action.
Hello, thank you. As I'm here before this esteemed gathering of delegates and fellow representatives, my memories of the polio eradication efforts during my childhood in India come rushing back. I recall dedicated health workers who would knock on my doors, ensuring that every child received their oral polio drops. Regrettably, this cannot be said for my friends in Afghanistan, Pakistan, Malawi, Mozambique, where polio has resurfaced. When we reflect upon history, we realize that pandemics are not a new phenomenon. They're not a matter of if, but when. But what if we can make COVID-19 the last pandemic? What if we can ensure equity in access so that when I receive my vaccination in America, I'm not burdened with the guilt of knowing my elderly parents in India haven't received the same protection? How would our world be different if we hadn't lost over 6 million lives to COVID-19? What would our conversations around dinner table look like? Unfortunately, we have been deprived of these possibilities because we have failed to take decisive action. We can no longer afford to continue down this path. COVID-19 has stripped away many things from me, but most devastatingly, it has robbed us all of someone we hold dear. It is evident that merely containing outbreaks will not suffice in preventing future pandemics. The majority of recent pandemics have arisen from zoonotic origins. Approximately 60 to 75% of emerging infectious diseases in humans are zoonotic in nature. Therefore, effective pandemic prevention must include measures to prevent zoonotic spillovers. Indigenous communities, although making only 6% of the global population, serve as the guardians for over 80% of the world's biodiversity, which are the potential hotspots of spillover events. Yet, we neglect to provide these frontline communities with the quality, affordable care they need, despite knowing that they will be the first affected by a spillover event. How many more lives we can lose before we can effectively combat the next Ebola or the next COVID-19? How many more pandemics must my generation witness before one of them claims our lives? It is evident that responding to outbreaks alone perpetuates inequities. Lives continue to be lost under this containment-only approach, predominantly in low and middle-income countries. We must delve deeper and address the root causes of preventing outbreaks from occurring in the first place. The time for global solidarity has come. It's time to demonstrate the political will and commitment necessary to bring an end to pandemic events. It's time to ensure that future generations are not robbed of their parents, partners, or a normal childhood. Let us commence by prioritizing the prevention of zoonotic spillovers, and let us strive to prevent outbreaks and in turn prevent pandemics. Thank you.
Thank you very much. Medicines Patent Pool.
Thank you. The Medicines Patent Pool, or MPP, is a non-governmental organization that utilizes voluntary licensing of intellectual property and technology transfer to a broad network of generic manufacturers to enable affordable access to new health products in LMICs, with demonstrable success in HIV and other disease fields. Recently, MPP, alongside the WHO, has established the mRNA Technology Transfer Program to build equitably distributed mRNA vaccine manufacturing capacity in 15 to 20 countries across LMICs. During a pandemic, the world does not have the luxury of time to sort out access strategies while the clock is ticking and lives are at risk. The inclusion of equitable access conditions in funding agreements can help address questions of affordable access long before a product comes to market. And this is especially important in the context of PPPR. Public, multilateral, and charitable financing of R&D can be conditioned on funded entities taking sufficient measures, by voluntary licensing or otherwise, to ensure that every medical technology is available and affordable to all. Such conditionalities can be equally viable no matter whether in the funding of R&D for a pan-TB regimen or for treatments of NCDs or any other. Affordable access to medicines, vaccines, and other medical technologies is essential to achieving UHC and cannot be a secondary thought in the context of a pandemic. MPP stands ready to lend its expertise in licensing and technology transfer and its existing networks in furtherance of PPPR efforts and to achieve UHC. Thank you.
Thank you, Mexico.
Gracias, muy buenos días. Hoy les hablaré desde la visión de un sistema de salud subnacional, el estado de Chihuahua en México. Las lecciones aprendidas no siempre suelen ser una enseñanza para algunos líderes, gobernantes, servidores públicos y personas de la sociedad en general. La memoria les es muy corta y es a ellos a quienes hoy llamamos a la acción, para quienes sí queremos sistemas de salud fuertes y resilientes, y que en lo aprendido en la pandemia por COVID-19 se convierta en programas sólidos que contengan una planeación integral en diferentes niveles de gobierno, sistemas y sectores. con la creación de una plataforma que permita la medición de resultados e impacto de las estrategias aplicadas con un estricto componente de rendición de cuentas. El financiamiento debe ser en el mismo sentido de colaboración intersectorial y con un mecanismo de seguridad y transparencia, pero sobre todo garantizado. Las regulaciones deben ser tan fuertes que alcancen los niveles subnacionales y locales, y aún más allá hacia los diferentes sectores, ya que esta pandemia nos demostró como nunca que no podemos abordar una emergencia en salud solo desde los sistemas de salud. Es imperativo que los planes de preparación incluyan el blindaje de los determinantes sociales estructurales, ya que son el pilar de la prevención, y sobre todo un mecanismo para la inclusión de las organizaciones de la sociedad civil y el sector privado como participantes activos de estos planes. Gracias.
Thank you, Argentina.
Muchas gracias. La Argentina celebra la participación activa de las organizaciones no gubernamentales y otras partes interesadas en esta audiencia. Destacamos la importancia de la equidad como principio rector. La cooperación y la solidaridad son los dos pilares centrales que permitirán afrontar los desafíos por delante y prepararse para otra eventual emergencia sanitaria. En este sentido, la Argentina ha apoyado toda iniciativa regional o global destinada a facilitar el acceso universal, equitativo y gratuito o suficientemente asequible a insumos estratégicos como vacunas, medicamentos y otras tecnologías, en especial en países de medianos y bajos ingresos. La Argentina también ha redoblado sus esfuerzos para expandir la investigación, el desarrollo y la producción de insumos críticos con miras al fortalecimiento de las cadenas globales de suministro, habiendo sido seleccionada por la OMS como hub de producción de vacunas, con el objetivo de promover el acceso oportuno de nuestra región a insumos críticos. Para la Argentina, los medicamentos, vacunas, tratamientos y otras tecnologías sanitarias desarrolladas en respuesta a una emergencia de salud son considerados bienes públicos globales y un componente esencial del derecho a la salud. Debemos asegurarnos de crear sinergias entre las iniciativas y diálogos existentes para procurar evitar la duplicación de esfuerzos y la superposición de las negociaciones en curso a fin de mantener la coherencia entre los múltiples procesos. En ese sentido, destacamos el rol coordinador de la OMS. Para finalizar, respecto del INB, la Argentina sostiene su compromiso para trabajar constructivamente en un nuevo instrumento que contribuya a una mejor preparación y respuesta a futuras emergencias de manera transparente, inclusiva y garantizando la participación equitativa de todos los Estados miembros. Muchas gracias.
Thank you, Indonesia.
Thank you, Chair. COVID-19 pandemic teaching us a hard lesson that not being prepared for future pandemic is detrimental to our livelihood and hampering our SDGs achievement. Therefore, Indonesia remains committed to join the collective efforts of strengthening pandemic prevention, preparedness, and response at global and regional levels. It is done, among others, through our contribution as one of the core group members that has proposed the high-level meeting on PPPR to be held in 2023. Chair, many works needed to be done in our efforts to strengthen pandemic prevention, preparedness, and response at global, regional, national, and local levels. Some of the works that we believe are important, including, first, ensuring PPPR is formulated and implemented based on people-centered approach as its foundations. Second, implementing a stronger multi-sectoral collaborations. Pandemic is an interdisciplinary issue affecting people's lives socially and economically. As much as it is medical and health issues, the pandemic is also political and social and economic issues. And our last point is health and finance interlinkage. Learning from the interdisciplinary nature of PPPR, Indonesia's G20 presidency in 2022 has highlighted the importance of financing required for PPPR through establishing a pandemic fund. The fund provides support countries in its effort to strengthen health infrastructure and build resilience to future pandemic. Financing plays an essential role in ensuring the timely implementation, continuation, and sustainability of PPPR efforts. Therefore, Indonesia will continue to work together with all member states in advancing and contribute in our collective efforts in strengthening the PPPR agenda. I thank you, Chair.
So in our list of speakers, we now come to the last speaker, which will be Dominican Republic.
Muchas gracias. La República Dominicana expresa su agradecimiento a los panelistas por liderar este debate sobre prevención, preparación y respuesta ante pandemias y por ofrecer recomendaciones concretas sobre lo que esto implicaría y cómo llevarlo a cabo. La pandemia del COVID-19 ha puesto de relieve la urgencia de reevaluar la eficacia de nuestras instituciones y sistemas. Estas se han construido en función de nuestras necesidades cotidianas y tienden a pasar por alto nuestras necesidades en situaciones de emergencia. Por lo tanto, tenemos que preparar nuestras capacidades para el futuro basándonos en nuestras necesidades y en los retos a los que podemos enfrentarnos durante las emergencias. Esta estrategia garantizará nuestra preparación constante y sostenible y mantendrá sistemas resilientes. Hay un impulso importante a medida que nos acercamos a las 3 reuniones de alto nivel relacionadas con la salud. Nuestras aspiraciones no deben limitarse aquí, sino que debemos aprovechar los encuentros que se aproximan para promover un enfoque multisectorial, extendiéndose a otros procesos como la revisión de los Objetivos de Desarrollo Sostenible durante el Foro Político de Alto Nivel, la Cumbre sobre los ODS y la Cumbre para el Futuro. Cuando utilizamos un enfoque multisectorial para el desarrollo de capacidades, ¿cómo priorizamos factores críticos precisamente en los pequeños estados insulares en desarrollo que tienen que hacer frente a retos actuales urgentes? ¿Y cómo pueden estos países abordar respuesta global sin mecanismos de financiamientos más adecuados y accesibles? Gracias.
Okay, thank you very much. I think most of you spoke within your allocated time, and thank you. I really appreciate it. There are those of you who are going to be included in the next round. I saw that a vaccine alliance, I think, raised. You will be speaking in the next round. For this session, I think we have finished. I'd like to thank the panelists first and thank all of you for your contribution. We had quite a number of contributions. I think I'll be doing an injustice if I try to summarize what you said, because I'll cut down on the most crucial points you've raised. And I don't want to diminish that, nor dilute what you've said. I'd rather stop here so that we can invite the next panel. So what we'd like to do now for the next session, before I conclude, is to remind all of you that you are also welcome to submit written statements. So I would like to invite, in addition, because you spoke for 2 minutes, some of you may have liked to have elaborated more. I think it would be good to also submit written statements. And I would also like to say that we will be moving to the second panel, and the second panel's discussion is entitled Investing in Pandemic Prevention, Preparedness and Response, and it will begin immediately after the conclusion of this panel. I thank you all. We will now adjourn. Can I use this? Or it's just for the president? Thank you.
Can we take our seats, please? The second panel discussion of the interactive multi-stakeholder hearing on the topic of investing in pandemic prevention, preparedness and response is now called to order. I am Zaid Ra'ad Al-Hussein, President of the International Peace Institute, a professor of the practice at the University of Pennsylvania, and a member of the Elders, and I have the honor to moderate this session. In this session, we will continue to listen to you, to those who 3 years after the start of the COVID-19 pandemic are steeped in expertise, have distinct experiences, or represent particular communities, all of which could help guide the member states of the UN on what needs to be worked into the upcoming political declaration and in the light of the negotiations that are starting at the INB and at the WGIHR. Because of the little time allotted to everyone speaking today, and through no fault of anyone in particular, what can't be captured in a succinct or pointed verbal statement ought to be written down and submitted to the Indico registration page, and it will be posted online. Naturally, we are not here to toast the triumph of modern science and the end of the public health emergency of international concern. The task awaiting us as a global community remains too imposing for that. And after the death of some 7 to possibly over 20 million people, and with so many national treasuries emptied for the sake of prevention and recovery, celebrations should be trimmed accordingly. Instead, we continue to turn on the question of how we ensure, guarantee actually, the non-repetition of anything resembling COVID-19 or worse. The distinguished independent panel proposed a course, the World Health Assembly took a decision, and the INB and WGIHR are in operation, and an overall strong agreement will have to be forthcoming. The World Health Assembly and the General Assembly must ensure it. Precious Matsoso kindly explained to us in the previous session how the microphones work, and so with your permission, I won't go over it again in detail. If you would like to speak after the panelists, please press the button located at the base of the microphone in order to be placed on the list of speakers, and we already have some left over from the previous session, and please fill out the card, the white card in front of you. We will now hear presentations from our panelists, and thereafter the floor will be open for comments, observations, and questions. Panelists are reminded they have 4 minutes each to answer the question I will pose to them, and at 3 minutes 40 seconds, I'll ring this little bell, and to let you know you have 20 seconds left before turning over to the next speaker. And having just listened to the previous panel, I'm sure I won't need to ring the bell at all. The question I have for all the panelists is, as we look forward towards the pandemic prevention, preparedness, and response, as we look forward towards pandemic prevention, preparedness, and response, and the investments that need to be made, can you share some key points for the consideration of member states when they negotiate the political declaration? I now invite Dr. Ayoade Alakija, co-chair of the African Vaccine Delivery Alliance. Dr. Alakija, you have the floor.
Thank you very much. Excellencies, friends, comrades. As we focus on the need to invest in PPPR, we must first acknowledge the political complexities of making this investment happen. Political leaders and global political leadership failed we, the citizens of the world, during the COVID pandemic. With a few notable exceptions and a few beacons of light, many of whom were women, those who demonstrated leadership that put people before profit. It was largely profit that ultimately won over to the detriment of the citizens of the world. 20 million dead and counting. This upcoming high-level meeting is an opportunity to ensure that that never happens again. To be prepared for future threats, we need a dynamic state of readiness that we need to construct, a state of readiness that necessitates systemic resilience at local, national, regional, and global levels. We cannot keep talking and making ephemeral statements in the absence of concrete action, and therefore, yes, one supports the establishment of a Global Health Threats Council, one that acts and not just speaks, one that brings a political attention of the world to the forefront of what these competing crises are. The world has hitherto failed to adequately invest, to equip, and to develop the tools that we all need to mitigate the next crises, with both the urgency and the equity that is required. We failed to prepare with COVID, and so doing so, we prepared to fail. Until there is a universal political acknowledgement of the need to address the confluence of multiple and reinforcing crises in a holistic and comprehensive manner, there will continue to be substantive health and climate threats which result in risks to everything, from our lives to our livelihoods, to our financial, political, and economic systems. Therefore, we really welcome this high-level meeting and welcome the ensuing declaration, which one hopes will provide world leaders with an opportunity to maintain political attention and commit to greater investment in collaborative actions moving forward. What are these investments? We need investments in human resources. We need financial investments. We need a reform of the global financial systems that failed us in this pandemic. We see funding silos that are not addressing the needs of the communities that they're supposed to address. A declaration that follows this high-level meeting must reflect on the urgency of the times. It must be informed by voices from the Global South, voices from the communities, and be different from previous declarations that have not really implemented the changes or resulted in concrete action. The high-level declaration must avoid the polarization, fracturing, that is common in political dialogue and concentrate on producing a clear, comprehensive, implementable and inclusive declaration to address future threats. We do not have the luxury of making any more mistakes, and we cannot afford to leave anyone behind. Africa was left behind in this pandemic. Millions died. Millions more will live with long COVID and the sequelae of this disease. And yet they go uncounted, unheralded, because we did not have the diagnostics, never mind the vaccines. We did not have the basic tools. We did not have basic oxygen. The next threat might not be as kind as COVID was, even though COVID does not seem to have been that kind to us. But it might not be that kind. The next threat might be the one that wipes us all out forever. And for that, we must take this with the seriousness that it deserves. This is not the time for debate. It is not the time for rhetoric or arguments over power. This is a time for concrete action, an investment in the tools that will be needed for the future to actively and adequately prevent future threats. We must prevent both, not just health threats, but we must prevent climate threats. We must prevent all of the things that are looming large before us, as some of us landed in New York yesterday wearing winter coats and realized that it was the height of summer at the wrong time of the year. These things are here, they are before us, and I urge all member states and all our colleagues to actively work with us to ending this. Thank you very much.
I thank Dr. Alakija for her remarks, and I now invite Ms. Ana Maria Beya, Director, Public Policy Engagement from Gavi.
Thank you, Chair, and good morning, Excellencies and distinguished guests, colleagues and friends. It's a pleasure for me to speak on behalf of Gavi, the Vaccine Alliance. And what we will propose today to be included in the political declaration is based on experience in our learnings from having worked with countries and help them to deliver 981 million benefiting and vaccinating 981 million children, together with UNICEF and WHO since the year 2000. And also for having leading still the COVAX facility that, despite so many challenges, delivered 2 billion COVID-19 vaccines. We have learned many lessons. Our experience is telling us that equity should be prominent in the principles at the center of the political declaration. Equity underpins the following 7 points that we would like to propose for your consideration. A focus on prevention by strengthening health systems is crucial to build resilience between pandemics, particularly primary health care, to reach the communities most left behind. Within primary health care, which is part of community health, of course, expanding access to and investing on routine immunization is fundamental, not just to prevent disease, but also to strengthen entire service delivery services, including supply chains, data systems, and community engagement that enable early detection and effective responses to outbreaks before they become pandemics. The second point is investing in universal health coverage. We consider that fundamental to ensure access to tests, vaccines, and treatment for everyone, everywhere, and that no one experiences financial hardship to save the life of a loved one. This is not just a moral imperative, but also an epidemiological one, because nobody's safe until everybody's safe in a pandemic. Third, a people-centered approach with gender equality is fundamental. Access to tests, vaccines, treatments, and any other medical countermeasures during pandemic is not possible without health workers to deliver them. Improving their working conditions, the terms, the professional development, including remunerating community health workers, is essential. As 70% of health workers are women, gender policies that address equal pay, safeguarding, and opportunities for women to take leadership roles are of essence. 4, financing for pandemic prevention, preparedness, and response should be contingent and agile, ready for day one, to support surge capacity for a coordinated global response. 5, investing on diversified and expanded regional manufacturing capacity that increases vaccine supplies between pandemics is really critical. Gavi is very proud to be working with the African Union to achieve their goal of vaccine manufacturing capacity development. 6, to ensure timely and broad access to pandemic products by populations living in humanitarian settings, there is an urgent need to remove legal, regulatory, and operational barriers for this context. And finally, investment is not just money, it's time and energy and imagination in times of crisis. And we need to put the best of our efforts to collaborate among each other, among sectors, to achieve the Sustainable Development Goals. This is of crucial importance, and also because health is not the only sector that is important for a pandemic. So thank you very much.
Thank you. I thank Ms. Bea for her remarks, and I now invite Dr. Ricardo Baptista Leite, founder and president, Unite Parliamentarians Network for Global Health. Dr. Ricardo, you have the floor.
Thank you, Chair, Excellencies. As we step away from the COVID-19 pandemic, after millions of lives have been lost, after trillions of dollars have been taken away from our global economy, we know that if nothing is done, as we've heard today, it's not a question of if, it's a question of when the next pandemic will hit. And not acting seems like not an option. However, when we look at the World Economic Forum report earlier this year, where political leaders and business leaders come together to put health emergencies way at the bottom of the list of priorities of what needs to be dealt with. And the truth is, if a new pandemic does emerge, it's our responsibility. There is no room for excuses. It's on our watch now. As president of the Unite Parliamentarians Network for Global Health, representing parliamentarians from nearly 100 countries around the world, we know that united we stand, but divided we will fall. And ignorance or lack of knowledge of the negotiating process among parliamentarians is too high. We need to make sure that those that will ratify a potential accord be involved. And that's why we have been discussing with the kind openness of Honorable Matsozo, the possibility of a hearing within the INB specifically for parliamentarians to get them on board. But I'd like to share with you 3 main ideas for the declaration to be the outcome of this meeting. And I describe them as people, science, and commitment. The first is people. And the truth is, we know that strong, resilient health systems are critical for us to be better prepared in the future. But universal health coverage cannot be us exporting models from the richer world in terms of healthcare that do not work to low and middle income countries. We cannot continue to push for disease-driven models of care. We need to focus on well-being, and we need to use digital transformation towards making health and well-being critical, and to make sure that patient organizations and NGOs are put in the driving seat, or else we will not reach those that are in most vulnerable situations. We've seen it in other fields. We've seen it with HIV and AIDS. We know that's a general rule. Secondly is science. And we must invest in preventing the next pandemic by ensuring the funds to fight the consequences of COVID, which still continue to harm millions worldwide. But it is also critical for us to improve access to health products and scaling up R&D investment. But we need to acknowledge that the pandemic has redesigned globalization at large. A new world order has emerged. We hear member states asking for more self-sufficiency at the regional level. That needs to be included within the final declaration and within the accord mechanisms to respond to this new globalization, this new model for globalization. We also need to make sure that we use the power of digital to turn healthcare more humane and not less. We need to use the digital transformation to end the digital divide and not make it bigger. The third and last topic is commitment. Of course, we need money, and finance is critical. And parliamentarians, we approve budgets in our own parliaments, and we need that funding, or else UHC, surveillance mechanisms, R&D, digital, none of that will become a reality without the proper funding. And we also need to get the private sector on board as soon as possible. And we also need accountability, positive accountability when it comes to countries, like what we should be ashamed of what happened with South Africa for being one of the best among genomic sequencing and then putting on the sidelines during the COVID pandemic. Those doing their jobs should have a benefit. But accountability also, and to end, Chair, accountability also when it comes to keeping our governments accountable, and as parliamentarians, we have a very important role. So as my time has come to the end, I would just like to say that such as with freedom and democracy, health is a vital prerequisite to our global sustainable development, there is a civil rights song that said that for health you've got to work for it, fight for it, and every generation has to win it again. This is the time of our generation. It's time to unite. Thank you.
I know we've asked people to speak quickly because of shortness of time, but please remember to breathe while you're speaking as well. I thank Dr. Lette for his remarks, and I now invite Ms. Angela Kane, former UN Undersecretary General and Senior Advisor, Nuclear Threat Initiative. Ms. Kane, you have the stage.
Thank you very much, Chair, and I'll try to breathe. And Excellencies, all of us here really want to make changes for the better. And two of the statements that were made yesterday really rang true with me. And one is, when health is at risk, everything is at risk. And the second, development cannot take place if there is no health. The last 3 years of COVID have shown us the devastating impact of a pandemic, but also highlighted global vulnerabilities to high consequence biological events. We know that the international community was woefully unprepared for a pandemic, and we know the results that we've seen. But let's look at the positive. It was a warning shot because it has provided the opportunity to improve. It will not be the last pandemic that humanity faces, and the next high consequence biological event might be as destructive or maybe even substantially worse. So what can we do to protect against high-risk biological events? And the question is, are we doing enough to rapidly identify cases where there's ambiguity of an outbreak? We know that biological events can come from a variety of sources: an infectious disease outbreak, an accidental release of a pathogen, or even a deliberate attack. I will not sketch out proposals on a global scale, but I would like to focus on the United Nations' ability to address this issue. And I will point out some gaps in this system that are important to address, in my view. The international community has some mechanisms in place to help figure out the source of biological events, but there are significant gaps. On one end of the spectrum, the World Health Organization is well positioned to assess outbreaks of natural origin, so-called spillover, from animals to humans, and has both a comparative advantage and clear support from its member states in these situations. However, WHO is still deciding how far it will go to assess an outbreak origin once signs begin to emerge that it may have resulted from a lab accident or a deliberate bioweapons attack. This is an important decision because WHO needs to maintain the trust and openness of its member states to carry out its public health mission, and engaging in security-related issues could make that difficult. On the other end of the spectrum, you have the United Nations Secretary General's mechanism, which has the authority to investigate allegations of deliberate bioweapons use, but its mandate is limited. It can only investigate allegations of biological weapons use when countries bring them forward, and that has never happened in the over 40 years it's existed, likely due to the very high bar for making a serious allegation which requires a lot of hard-to-collect evidence. There is no mechanism in the United Nations system to assess events of unknown origin that fall between the scope of these two mandates. Then that raises the question, are we doing enough to rapidly identify cases where there is ambiguity about a source of an outbreak? And this is important because the ability to rapidly discern pandemic origins is critical for mounting a rapid, effective response and for preventing future high-consequence biological events. The challenges of discerning COVID-19 origins have highlighted the need to fill this gap. Determining the origins of a disease outbreak in a forum that is scientifically based, internationally trusted, and as insulated as possible from geopolitics will increase confidence in the eventual answer. Our meeting today underlines two priorities that are clearly important to the UN and to the member states, as well as to the larger part of civil society we have here. One, building more effective international capabilities to assess pandemic origins, and two, building broader capacity for pandemic preparedness. This is what we need to invest in. I have been working with colleagues to identify solutions to address the gap in international capabilities to assess the source of outbreaks of unknown origins. I've put my expertise and years of experience gained in the UN, both at headquarters and in the field, to find a way forward, though fully aware of the complexities involved. Now is the time to take concrete steps. Civil society have called for commitment to action, the attention to this issue and the efforts by the Secretary General, the UN system and the member states highlight the need to find a way to address this crucial gap. Thank you.
I thank Ms. Kane for her observations, and we'll now turn it back to you, to the floor. We have 45 minutes allotted to this, and interventions from the floor, as before, will be limited to 2 minutes. I would like to give the floor now to the People's Vaccine Alliance.
Hello, and thank you. Just to say that the current COVID crisis, the HIV, the Ebola, all the crises before, must put health at the top of the priority agenda for all world leaders. However, maintaining the current system of access to medical technologies will just maintain monopoly, maintain inequality, create the same systems, the same results that we had with HIV when people were dying while medicines was around, and what we have now for COVID vaccines. Therefore, we think that the declaration should have clear commitment from governments to enable local production as a way of ensuring sustained supply of countermeasures. That means commitment to sharing technology, removing intellectual property barriers, investing in R&D in the South by southern governments and by everybody else, and investing in actual manufacturing. Without these, we will not have sustained production of countermeasures. Also, implementing conditionalities in public financing for R&D and for purchasing. Transparency and accountability mechanism to enable civil society and community participation in decision-making and monitoring. Finally, we have to be honest and say that Act A and COVAX failed Africa. Thanks, Carlos Correa, who mentioned that before. Therefore, the declaration should ensure that it has enabling the countries and regions in the South to lead and take decisions about financing and delivering and making these products, and not just wait for charity from pharmaceutical companies who made enormous profit at the expense of public health. Thank you.
Thank you. The next speaker on my list is from Solidarity for Vaccine Equity, Solve Research Team. You have the floor.
Good morning. I am grateful to be here on the homelands of the Lenape people. I traveled to join you here from where I live on the traditional and unceded territory of the Syilx people in what is now known as British Columbia, Canada. And I offer these comments on behalf of the Solidarity for Vaccine Equity, or SOLVE research team, for which I'm the nominated lead. Drawing upon the best available evidence across relevant disciplines, we offer 3 recommendations to ensure a political declaration serves rather than undermines equity in PPPR. First, a declaration should recognize the realities of global inequities and the evidence of their being caused by the unfair distribution of resources and power, and affirm the importance of operationalizing equity intentions. The WHO Commission on Social Determinants of Health and the broad field of research that follows offers a rich base of evidence from which to draw. Second, recognizing the moral and ethical obligations to respond to the causes of inequities, and acknowledging that health inequities are at risk of being made worse and also, in and of themselves, pose risks for worsening the scope and scale of future pandemics. A declaration ought to confirm the importance of consistent and coherent investment in ensuring all people worldwide have access to the most essential resources and basic conditions necessary to live a healthy life, including the protection of fundamental human rights. Evidence-informed policy solutions are available and could serve global governing bodies in practical and meaningful ways. Third, fragmentation in governance efforts creates avoidable resource scarcity and perpetuates inequities. A declaration should prioritize harmonization with equity as a guiding principle. Doing so requires providing resources to listen for direction from the voices of those most affected by decisions of global governing bodies, and not those already holding greater power and resources. I urge those responsible for drafting the political declaration to center equity in your work and to be guided by the evidence available to you, and to leverage this work as one important and incremental contribution to collectively building a more equitable future together. I thank you.
Thank you. And the next speaker is from the Pandemic Action Network.
Thank you. My name is Agri Aluso, Pandemic Action Network representative, a coalition of more than 350 partners who definitely have varied views on many issues because we come from different regions. But we are united on the belief that keeping humanity safe from pandemics demand urgent action by all of us, and more particularly from political leadership. 3 years into the costly and deadly pandemic, the first time leaders come together to discuss PPR, we have bold ambitions, and we are very hopeful that we will use this opportunity to really make a difference for humanity. We still continue to lose more than 1,000 lives every day due to COVID-19 pandemic, and the urgency is still as important as it was yesterday. We have 3 key points that we would love the declaration to really take into account. First, really political leadership in ensuring equitable financing. COVID has shown us that pandemics are not only health, there are also issues of security, there are also issues of economy, there are also issues that affect society in various ways, and really are an impediment to achievement of human development ambitions as spelled out in SDGs. Secondly, accountability is very paramount. We call for a robust set of monitoring and accountability mechanisms in the high-level declaration, starting with a progress review in 12 months at the summit for the future that is due for next year. More importantly also, issue of equity, which has been emphasized by many colleagues who have spoken before me. we must ensure equitable, affordable, and global access and delivery of pandemic countermeasures, and it must be designed and convened by low and middle income countries. Thank you.
Thank you. And the next speaker is Sight Savers International Disability and Development Consortium. You have the floor.
Thank you, Chair. Thank you, Chair. Effective PPPR depends on leaving no one behind within countries as well as among countries. Available, accessible and affordable quality primary health care and realisation of the right to health for all people are prerequisites for effective PPPR. It therefore depends on addressing and preventing discrimination and other unjust and unfair barriers that drive inequities and heighten risks for many individuals and groups within countries. It means ensuring equity of access to health services, goods, facilities and information, and it extends to the wider determinants of health equity and the realisation of associated economic, social and cultural rights, including rights to food, an adequate standard of living, education, social security and a healthy environment. In particular, it means the absence of unfair, avoidable or remediable differences among groups of people, whether they are defined socially, economically, demographically or geographically, or by other dimensions of inequality. We call on heads of state to recognise that equity within countries and realisation of human rights are integral to PPPR, to commit to respect, to protect and to fulfil human rights across all phases of PPPR and for all people without distinction of any kind, including the right to health, education, social security and an adequate standard of living. To commit to measures and actions needed to ensure equity within countries, and also in particular, given the consortium that I'm speaking on behalf of, to recognise that the world's 1.6 billion persons with disabilities, and especially women and girls with disabilities and also older people, have been among the most left behind and the most at risk, and that's in the COVID pandemic, and that specific and positive measures are needed to ensure equity and protect and fulfil their human rights in PPPR. Thank you, Chair.
Thank you. And the next speaker on our list is the delegation of El Salvador. You have the floor.
Muchas gracias, señor presidente. La celebración de esta audiencia interactiva posterior al anuncio realizado la semana pasada por la OMS sobre el fin de la emergencia sanitaria vivida por la pandemia del COVID-19 nos coloca en un momento único para recoger las lecciones aprendidas de tiempos sumamente complejos, mismos que requieren de reflexión y cuyos resultados deberían ser insumo primario para los procesos que emprenderemos durante los próximos meses. El Salvador fue uno de los primeros países en reaccionar a la emergencia bajo un enfoque de prevención que marcó grandemente la diferencia en nuestros resultados y que puso en perspectiva la necesidad de fortalecimiento del Sistema Nacional de Salud, paralelo con la toma de decisiones económicas y sociales de apoyo a aquellos particularmente afectados por las consecuencias que la pandemia trajo. Para mi país, las lecciones aprendidas son múltiples y coincidentes con las áreas de inversión clave que deberían ser punto de partida para prepararnos hacia el futuro, mismas que abarcan, en primer lugar, la necesidad de hacer efectiva la solidaridad y la cooperación internacional a todos los niveles, particularmente para que el acceso a vacunas sea universal, asequible, eficaz y equitativo, en lugar de discrecional e inmediato únicamente a países específicos, tal como sucedió al inicio de la pandemia. También la necesidad de invertir en el fortalecimiento de capacidades en el nivel local y asegurar una cooperación interinstitucional fuerte, de manera que al enfocarnos en atender la crisis no tengamos que priorizar un área de trabajo. Áreas como la educativa, incluso dentro de circunstancias extraordinarias, no son negociables. Para este fin, la continuidad en la inversión de nuevas tecnologías y el aprovechamiento de las ya existentes, como las plataformas virtuales, debe ser prioritario. Con el pasar de los meses, incluso la organización ha desplazado poco a poco la celebración virtual de eventos en formatos que permitirían a más personas incorporarse. Retomemos esas lecciones y sumémoslas al proceso. Finalmente, me permito destacar el valor que la inversión en salud mental debería tener para todo lo que decidamos emprender, siendo un factor transversal en el que consideramos determinante ampliar esfuerzos y el cual esperamos
sumar como un punto valioso de discusión de camino a las discusiones de la reunión que nos encontramos preparando. Muchas gracias.
Thank you. The next speaker is Worldwide Hospice Palliative Care Alliance. You have the floor.
Good morning. Thank you, Chair. The current zero draft of the Pandemic Preparedness and Response Treaty makes no reference to primary care, serious health-related suffering, or palliative care, despite there being 7 and possibly 20 million deaths worldwide as of March of 2023. This omission is unacceptable. Palliative care has been a crucial part of the response to the pandemic. The pandemic resulted in many patients dying with serious health-related suffering, including respiratory distress. Palliative care was critical in improving both the quality of life and the quality of death where it was available. Critical care health professionals, including nurses, didn't sign up to care for so many people dying alone. The importance of raising awareness of the need for palliative care can't be underestimated and should be anticipated for the future. This necessitates recognizing the need for training in palliative care at a basic level for all health professionals so that they're aware when palliative care is needed and when to call for help. This treaty has to include reference to palliative care, where member states will not include relief of suffering, a basic human right, in their response. Thank you very much.
Thank you. And the next speaker on the list is Amnesty International. You have the floor.
Amnesty International thanks the opportunity to participate in these crucial and timely conversations. In 2022, we released the report Unequal and Lethal, which assessed why Latin America and the Caribbean accounted for 28% of all deaths from COVID-19, when it hosts just 8.4% of the world's population. Our conclusions pointed out different factors, but ultimately all connect with the fact that our societies suffer a rampant inequality that excludes entire populations from health systems, especially women and indigenous peoples. The wealthiest 20% in the region amass half of total household income, while the poorest account for only 5%. This imbalance extends to the social determinants of health, work, water, housing, and food. The states have failed to redress it. As such, we come to this honorable chamber to urge states to strengthen their fiscal policies to reverse this situation and consequently bolster their pandemic preparedness and response. Under international law, states must seek the maximum available resources to achieve the full realization of economic and social rights progressively. Fiscal policy must therefore allow for sufficient resources to guarantee the right to health, to fund rights that are determinants of health, and to act as a true mechanisms to reduce inequality. We make a specific call to Latin American and Caribbean states, as the region collects only 18% of GDP in taxes compared to the OECD's 33%. Modifications to direct taxes, such as personal income tax, are an alternative to make the tax system more just and progressive. Health cannot wait, and we need urgent measures to ensure that what we lived through during the pandemic does not repeat. Financial resources for human rights must be priority. Thank you very much.
Thank you. The next speaker is United for Global Mental Health.
Thank you very much, Chair. Around the world, COVID-19 pandemic exacerbated already very high levels of mental ill health and highlighted the weakness and underfunding of mental health systems. In 2021, the World Health Organization produced WHA 74.14 Mental Health Preparedness for and Response to COVID-19 Pandemic. The report stated to scale up mental health services and psychosocial support as an integral component of UHC and in preparedness, response, and recovery for public health emergencies. In line with these recommendations and approach we set out by the WHO at the 74th WHA, we recommend on the HLM on PPPR to include the following. First, to acknowledge the negative consequences of COVID-19 on the pandemic on society, public health, human rights, and economy, which disproportionately affected PWDs, especially women, girls, and older persons with psychosocial disabilities, and disrupted provision of essential health services, which includes mental health services. Second, commit to reaching the globally agreed target of ensuring 80% of countries have a system in place for mental health and psychosocial preparedness for emergencies by year 2030. Third, apply a whole society approach to promote, protect, and care for mental health as an essential component of national preparedness for and response to pandemics. Fourth, ensure widespread availability of emergency mental health and psychosocial support. And lastly, increase resilience by building high quality and accessible mental health services for the future. When we think of PPPR, please do not leave behind mental health and psychosocial support. Thank you very much, Mr. Chair.
Thank you. I now give the floor to the delegation of the Republic of South Africa.
Thank you, Mr. Chair. Sorry. We're not used to suddenly taking floors like this. I'll be brief. South Africa didn't intend to take the floor during this debate, preferring to listen and hear what civil society and the private sector had to offer for us as we lead into one of the more difficult times and more intense negotiations. However, we've been mentioned and we find ourselves in many leadership roles, and it is incumbent to take a floor. So I'll just make a few remarks. For South Africa, the essential aim of the meeting in September is to find fair, long-lasting solutions to address the global inequalities and inadequate responses that the COVID-19 pandemic has highlighted for future pandemics. To this end, we wanted a succinct political declaration on pandemic prevention, preparedness, and response. This will need inclusive and durable solutions, and this is needed more than ever. It is our belief that a continuous demonstration of political will is vital to ensure that a whole-of-society approach to PPPR are adopted and operationalized. For this, we'll need concerted political action at a global level and an increase in international finance and willingness to adopt all measures to address PPPR. The reality is that the global pandemic and possible future pandemics hold the potential to be an existential crisis for humanity. We recognize that cooperation and unconditional support to unlock resources to fight pandemics would have collectively fought COVID-19 and eased the suffering of millions. We critically need to support the Geneva processes underway. South Africa will continue to remain steadfast in its support for the WHO to lead global efforts to mitigate COVID-19, as well as pandemic preparedness, and foster a comprehensive multi-sectoral approach to strengthen national, regional, and global capacities and financing and resilience to combat future pandemics. It is our view that the meeting should facilitate a political declaration for the global community to support pandemic prevention, preparedness, and response, and processes that are currently being discussed in Geneva, and to which we have pledged our unconditional support and wish to reinforce. It is imperative that we cooperate and coordinate ourselves such that we can prevent epidemics from spreading to become pandemics. And for this, we will require international coordination at a high level. Thank you.
As South Africa was speaking, and there's this voice from on high, I wondered whether there was a divine, some sort of... I'd like to turn over the floor now to the Wildlife Conservation Society.
Thank you very much. The Wildlife Conservation Society is the only international conservation organization with an embedded wildlife health program. We work in the field in more than 60 countries around the world, including Africa, the Americas, the Pacific, and Southeast Asia. WCS also engages in international policy and has been active in the WHO's IMB process to draft and negotiate a pandemic accord. As such, we offer the following statement. The WHO Pandemic Accord under negotiation is a once-in-a-generation opportunity to ensure that the strategies needed to prevent pathogen spillovers and disease outbreaks emerging in the first place are prioritized, along with post-spillover interventions aimed to curb human-to-human transmission and measures to prepare for, respond to, and recover from future pandemics. Pandemic prevention at source must be featured prominently in the WHO Pandemic Accord, the high-level political declaration, and any efforts aimed to protect current and future generations from the devastating consequences of the next pandemic of zoonotic origin. Thank you.
Thank you. The next speaker is Frontline AIDS. You have the floor.
Thank you very much. I add to the intervention made by my colleague at AVAC in the first panel in sharing a statement endorsed by over 100 representatives across civil society and communities. In order to ensure PPPR is informed by the key principles of equity, inclusivity, and human rights for all, funding is essential, but also needs to move beyond the donor-recipient model that reinforces underlying structural power balances that in turn sustain pandemic vulnerabilities for all. Funding needs to be longer term and capable of public health shaping investments that can drive additional financing to where it is needed most. Following the lead of the UNSG's high-level advisory board on effective multilateralism, it needs to promote the values of a global public investment approach to this critical global public good. The declaration must commit governments to develop an explicit plan for financing PPPR capacity development and resilient health systems with clear expectations of national governments and multilateral institutions, and ensure that such a plan conforms to the all contribute, all benefit, all decide principles of global public investment. The declaration should also commit that financing for PPPR must include allocation to support the key role of community-based health systems and community-led efforts for PPPR. Commit to full, longer-term funding that meets the need of existing multilateral institutions already contributing to PPPR, including the WHO assessed contributions, UNITAID, and the Global Fund to fight TB, AIDS, and malaria, of which more than a third of its investments advance global pandemic prevention and preparedness, and commit to common but differentiated responsibilities which recognize the different available resources and different needs of all countries. Thank you very much.
Thank you. The next speaker on my list is United Nations University International Institute of Global Health. You have the floor.
Excellencies, we urge you to establish a high-level council as an outcome in September and hold member states accountable for their commitments to PPR. The efforts led by WHO to reform the IHR and introduce a new pandemic accord are critical, but they are not enough. Pandemics are driven by and affect more than health. COVID-19 put all of society into crisis. Millions fighting poverty, trade suspended, economic activity driven to a halt. Member states utterly failed on their duties to protect the rights of the child, with children in every country out of school. This is not about Geneva or New York. This is about Geneva and New York and Cape Town and Rio and Stockholm and Bangkok. It's about everyone everywhere. It's about taking responsibility at the highest level of government, and it's time for accountability. We sit in this room today in New York City where over 45,000 of my fellow citizens died of COVID-19, including my father. 1 in every 4 New Yorkers had someone close to them die. Member states, this is in your hands. We appeal to you to make a commitment that matters and make sure that next time, and there will be a next time, the world is better prepared and states are held accountable to their commitments to action. As has been evidenced by other sectors, including human rights, chemical weapons, climate, and atomic energy, signing a treaty is not enough. Compliance requires independent monitoring, reporting to the highest level of government. A high-level political council made up of heads of states and their representatives can drive cross-national, multi-sectorial accountability and monitor member states' compliance with the pandemic accord. It's a both and and there is no body better placed to steward us to a safer world than the United Nations General Assembly. Thank you.
Thank you. The next speaker on my list is the delegation of the United Republic of Tanzania. You have the floor.
Thank you. My name is Nema Lugangira. I'm a member of parliament from Tanzania. And I want to commend the ongoing efforts and present the following key main issues that need to be considered in this pandemic preparedness declaration. The first one is, when we're talking about pandemic preparedness, we need to recognize the equity needs between the global north countries and the global south countries. And when we're talking about global south countries, it's very important for us to recognize the needs of urban regions versus rural regions versus cross-border regions. Because the COVID-19 pandemic showed us how these three different areas need to be considered for us to have a strong pandemic preparedness next time we are faced with the same situation. The second item is, as a parliamentarian, and I'm sure all of you noted that during the COVID-19, there was a lot of misinformation around the entire COVID-19 and the health advice, experts' advice that was being given, and the role that politicians had to play in that area. So it's also very critical when we're talking about pandemic preparedness to make sure we categorically recognize the role of politicians, particularly members of parliament, towards public awareness, education, to the communities, because part of pandemic preparedness is also how communities will react and how communities will believe the health advice that is being provided to them. And therefore, members of parliament have a critical role to play in that space. Finally, when we're talking about pandemic preparedness, we need to strengthen the community health systems. Without strengthening the community health systems, and if we focus just on global level, then we're not going to be able to truly prepare ourselves for the next pandemic. So we have to have strategic interventions for making sure that we strengthen community health systems. Thank you.
Thank you. The next speaker on my list is Asia Europe Foundation.
Thank you, Mr. Chair. Asia Europe Foundation would like to propose the inclusion of the antimicrobial resistance into the political statement on the pandemic prevention, preparedness and response, PPPR, as well as the one on the UHC. Latest numbers show antimicrobial resistant infections contributed to 4.95 million deaths globally in 2019. Considering AMR's gravity and impact on our society, AMR could be considered an ongoing silent pandemic. Please imagine, if we lose the effective antibiotics, the risk of the pandemic will be much larger. A next pandemic may be caused by not only unknown disease X, but also a used to be treatable disease. Therefore, AMR should be mentioned when discussing PPPR. Furthermore, the capacities required for PPPR are largely overlapped with those skills required to address AMR, such as surveillance and the capacity to develop and produce new therapeutic agents. Addressing AMR will strengthen PPPR, leading to global health security, GHS. Investing on PPPR, including AMR, is investment for the future, and it's also a national defense. It is global defense to protect people. Sufficient investments should be ensured. Lastly, we would like to mention that these are also connected to other UN high-level meeting health-related agendas. These capacities needed for PPPR, including AMR, strengthen health systems contributing to achieving UHC. The health systems will not be resilient without linkage with PPPR and AMR, and without addressing PPPR and AMR within health systems, UHC will not be attained. While all of society's approach is essential, recognizing a necessary linkage within the health sector will help draw political support pushing toward whole of government society approaches. Thank you, Mr. Chair.
Thank you. The next speaker on my list is AIDS and Rights Alliance for South Africa, ARASA.
Thank you so much, Mr. Speaker. My name is Dr. Ntombi Mchuchuti. I'm representing ARASA and the rest of the civil society in the world that are not here present, including the human rights defenders. My submission today is just to say that the pandemic just demonstrated the imbalance between four interfacing areas. The first one is the political will, the political decision, and the political mandate. The second one is the socio-economic imbalance, where low-income countries were left to find solutions for themselves, given too little and too late. Then the third one was the scientific evidence. It was not clear if the resources put to scientific measures were for response or for profit, where we are seeing that the manufacturing patents and distribution was profit inclined. And the last one was accountability measures, which were not part and parcel of the response plan. Therefore, the political declaration should consider earnestly having effective frameworks to guide what prevention and response means contextually and variable according to the regions, countries, and communities. And also, the political declaration should take into cognizance seriously the role of civil society in preparedness, and also the role of community in prevention. And lastly, we have to look at the PPR as a human rights, provision of medicines as a human rights, and sitting here at the discussion as people that are representing human rights issues in countries. Thank you very much.
Thank you so much. The next speaker on my list is the representative of Disability Rights India Foundation.
I am Smita Sadashivan, disability and health rights advocate from India, and also with the advisory group of the Civil Society Engagement Mechanism for UHC 2030. I am a person with disability myself. During the pandemic, we experienced a lot of barriers in our support systems. Our caregivers could not reach us. We didn't have support to access food, accessories like diapers and catheters, pharmacies, rehabilitation services, maintenance of assistive devices, and healthcare system became inaccessible. We could not get our regular infusions for NCDs or rare diseases in our district hospitals, nor could get admission in hospitals, and there was no support personal attendance to navigate the hospital procedures. So it was the civil society organizations who reached out to individuals in the vulnerable communities to support physical, mental, and social health and security requirements at their doorstep. Disability movement in India had to file a public interest litigation to get ourselves and other vulnerable communities included in the vaccination program, and worked out a doorstep vaccination program for people with disabilities and their caregivers and rare diseases persons and senior citizens in collaboration with the government of India and the state government. So in addition to engaging civil society organizations at all levels of decision-making, implementation, and monitoring mechanism, our key recommendation is to necessarily create a strong support system and licensing system of human resource and rehabilitation services at the community level, where information and services can be facilitated to the doorsteps of vulnerable populations, because they face multiple barriers in the society to even reach out to the services available at their own community. So unhindered and targeted support systems on health and well-being for all vulnerable populations during all health emergencies should be a non-negotiable within the health system of all countries. Thank you very much.
Thank you. The next speaker on my list is Global Health Advocacy Incubator. You have the floor.
Thank you, Mr. Secretary, and thank you, Mr. Chair. With WHO's announcement last week that the COVID-19 pandemic has ended, it is all the more critical that the United Nations High-Level Meeting on Pandemic Prevention and Response and its political declaration called for high-level political leadership to stop the cycle of panic and neglect by sustaining epidemic preparedness as a global priority beyond the health sector, and to ensure that the world will not repeat the public health, social, and economic trauma caused by the COVID-19 pandemic. The phrase pandemic, panic, and neglect was coined before COVID-19 emerged, yet the lessons learned from SARS, H1N1, and Ebola did not result in the sustained political commitment to build national, regional, and global pandemic resilience. Knowing these challenges, the global response to the COVID-19 pandemic cannot be conducted as business as usual. Multilateral institutions and governments must take stock of the global, regional, and national failures and address the widespread inequities exposed by the pandemic. To strengthen and sustain global cooperation and political commitment, the Global Health Advocacy Incubator encourages the UN High-Level Meeting Declaration to the Pandemic and PPR to establish a global platform to ensure timely, equitable, and affordable access to medical countermeasures and an enabling environment for local production. We also call for secure and sustained financing for preparedness and response, the establishment of a standing UN high-level mechanism to sustain political momentum, and reinforce the importance of a multi-sectoral response to PPR, such as One Health, WASH, and primary health care. While global instruments and financing mechanisms are urgently needed, the international response must also recognize regional and country-level priorities and the vital role of civil society in building political will for increased domestic resource mobilization that is both accountable and sustainable, and tuned to local context and priorities. Global pandemic preparedness priorities should dovetail with regional priorities and country action plans and frameworks, and complement local efforts to strengthen health systems and achieve universal health coverage, as well as embrace a whole-of-government, whole-of-society approach to future disease outbreaks. Thank you.
Thank you so much. The next speaker is Campaigns in Global Health.
Your Excellencies, the last 3 years have taught us that if you cannot detect and respond to one of the most prevalent respiratory infections, you cannot dream of detecting and responding to a novel one. Our failure to recognize this fact has resulted in millions of avoidable deaths from COVID-19 and has also prompted the first increase in incidence and mortality from tuberculosis in over a decade. TB has now reclaimed the unenviable title of being the world's deadliest infectious disease. Historically, political focus on pandemic prevention, preparedness, and response has followed a tragic boom and bust cycle as leaders shift focus to health threats felt by their citizens in the here and now. But this dichotomy is flawed. To break the cycle, member states must leverage the intersections to prevent, detect, and respond to novel outbreaks and accelerate the response to already prevalent public health threats. These include, but are not limited to, diagnostic networks, surveillance systems, strengthened infection prevention and control, an expanded workforce with competencies in managing respiratory infections, including at the community level, community-led service delivery, as well as research and development and medical supply chain strengthening. We know that respiratory pathogens pose the greatest pandemic threat because of the speed with which they spread. Many of the systems built for TB were core to the COVID-19 response, but remain insufficient to end TB, let alone prevent and respond to future respiratory pandemics. The political declaration of the UN high-level meeting on PPPR must therefore explicitly recognize these intersections and commit member states to prioritizing these within national policy frameworks and investments, with appropriate surge plans in place to protect core services during outbreaks. Crucially, accountability mechanisms for pandemics must also reflect these intersections and ensure much stronger engagement of civil society to ensure leaders genuinely deliver on and never lose sight of this dual return on investment. Thank you.
Thank you. The next speaker on my list is the delegation of China. You have the floor.
谢谢主席先生，各位专家。新冠疫情是人类的共同敌人。世界卫生组织宣布，新冠疫情不再构成国际关注的突发公共卫生事件，标志着全球抗疫取得了重要的阶段性成果，也标志着人类社会携手抗击病毒取得了重要的胜利。在抗击新冠疫情过程中，中国党和政府始终坚持人民至上、生命至上，秉持科学精准原则，因时因势优化调整疫情防控措施，不仅最大程度保护了本国人民生命安全，也成为向全球提供抗疫物资的大后方，成为国际抗疫合作的中坚力量。中方率先承诺将新冠疫苗作为全球公共产品，率先支持疫苗研发、知识产权豁免，率先同发展中国家开展合作生产，率先对外派遣医疗专家组。中国始终坚持支持和参与全球科学溯源，率先同世卫组织联合开展全球溯源合作。同时坚决反对政治化操弄、分裂全球团结。中方以自己的坚定承诺和实际行动，维护了国际抗疫的正确方向，有力推动人类卫生共同体建设。中方将继续同包括联合国和世卫组织一道的国际社会共同努力，为完善全球公共卫生治理、守护全人类的生命健康共同努力。谢谢。
Thank you. I'm afraid we have almost run out of time. I still have 7 speakers on the list, and I appeal to those who haven't been given the opportunity to speak to post the statements. They will be read, and they will be considered when it comes to the way in which the member states will then formulate the political declarations. So my deepest apologies, and I will guarantee you that the statements will be read. I would like to give the final few minutes to the members of the panel or the panelists to react to the interventions that were made from the floor. And could I begin on my left, please, with Dr. Alakija.
Thank you, Chair. It's been really great to see so many voices represented here today and so many statements that we've heard. A lot has sort of reflected and riffed off one another. However, I sort of note as listening to all of them that we're missing the financial institutions. We're missing the international financial institutions. It's imperative that we follow the money and reevaluate how financing instruments work for pandemic preparedness and response. And we really must look at amending funding instruments to ensure that they reach the most affected, in communities at the very last mile, not just the privileged few. So to finally answer the question that you asked me right at the beginning, we need to invest in communities. We need to invest in women and girls. We need to invest in women and girls. And we heard earlier about nurses and health workforce. Yes, health workforce, but we need to invest in the women and the girls as we prepare for future pandemics, because investing in their education, looking at the broader social context, is going to be core to that. We need to invest in transformative change at a political level. We've heard from, parliamentarians here, my sister from Tanzania, and so many others, that the transformative change that is needed is going to require an investment of, I said at the very beginning, of time, not just of financial resources. And we need to invest in making sure that this high-level declarations, I look to the co-facilitators and look to the ambassadors of Morocco and permanent representatives of Morocco and Israel, that this is an existential moment for our world, and that the job before you is huge, but there are so many hands around the table that are willing to join together to ensure that together we build a safer world. Thank you.
Thank you. Thank you. Would other panelists like to react? No? Dr. Ricardo? Thank you.
Thank you, Chair, and thank you to everyone. I think it was a very extremely important hearing with many ideas, focusing on the concept that when it comes to preventing the next pandemic, there is this collective conscience in the room that we cannot fail. There is a need for us to make sure that that message goes beyond this room and reaches everyone in power, in governments, but also in parliaments. And at the spring meetings of the World Bank, I asked the 300 MPs I had in front of me if they knew about the pandemic accord. Not one hand went up. So there is a lot of work to do to make sure that when an accord reaches parliaments for ratification and then for funding, that we have done our homework right. We have heard here today the importance of accountability, of finding new funding mechanisms, of addressing the determinants using UHC and digital, the importance of addressing communication, science communication, and addressing misinformation as one of the greatest challenges that has led to hesitancy and to lack of trust, which is undermining many of the efforts of those in this room. We as parliamentarians are committed to supporting all of the efforts of the INB, of WHO, and everyone in this room to make sure that we reach an accord as needed, that we can therefore protect the citizens we have sworn to protect. And I would like to end by acknowledging Mike Ryan's presence here today, because as a parliamentarian working throughout the COVID pandemic, we must express, as the Unite Parliamentarians Network for Global Health, our true gratitude to him and the whole WHO team for giving us guidance in such dark times of the COVID-19 pandemic. Thank you.
Thank you. Ms. Biar?
Thank you very much. It's been really stimulating and inspiring to hear everybody's voices. And I think we should continue this. I think the pandemic taught us that we need to work together. Despite our differences, despite our own kingdoms of knowledge and power, we do need to bring our differences in one place to take decisions forward. And this is the moment to cultivate that. The other point is that also we have a pandemic threat, but also a climate threat. And protecting our planet and linking the health of people with the health of the planet is also everybody's responsibility. It's really wonderful to see the engagement of civil society, of communities, of the people with disabilities, the people who were really suffering, as all of us suffered in the pandemic in one way or another, but there were some that were at the front line that we should recognize and have that in the efforts that wait for us ahead in the next few months. Thank you very much.
Thank you. Angela?
Thank you very much. I must say that I always love attending meetings of civil society because you have such passion. And very often at the UN, you don't always hear the passion from member states because they're very rational and they're always putting forward. So I really enjoyed the voices, but I also appreciate the input that was given by the member states, because ultimately it'll be landing on their lap. What are they going to do with this? How are they going to basically put it all together? What is going to happen with it? And I want to underline that the absence of the financial institutions is absolutely crucial. We always talk about the UN system, and let's realize the Bretton Woods system is part of the UN system, but it seems to me that they're always standing a little bit aside, and they're not really wanting to rope in by that. That's bad, and I'm very glad that my neighbor here went to the World Bank meeting and also brought it to their attention. We need to do a lot more outreach. And he also mentioned about the World Economic Forum, for example. That's a wonderful platform to also bring it out to the open. Now, the difficulty will be, of course, to knit it all together. The very different concerns, the very different challenges that you have raised, the very different issues that need to be addressed. How do we put it all in a document? And what is going to be done, it wants to be a joint document, meaning not a Geneva document, not a New York document. It has to be a UN system document. And that is really, really important that we need to keep in mind. But it will be a challenge. But we have this chance because Secretary General started it off by issuing a common agenda. And basically, he also had the high-level advisory board on effective multilateralism. There have been briefs issued, very important measures. We need to focus on it and push that vehicle down the road and get achievements. Thank you.
Thank you. Thank you, Ms. Kane. So we've reached the end of our allotted time. It's been an exceedingly rich discussion. I was warned before coming onto this panel that I could be confronting a circus, but you were also well behaved. It demonstrates to member states that one can be squeezed by civil society, and it's not bad to be squeezed. You know, we can't have accountability without responsibility and without being held to account, which means that we should not fear confrontation if the outcome is to the benefit of everyone. And so I think you demonstrated how useful this interaction is for member states. And I thank you all for your participation. And with that, I ask you, before concluding, to remain in your seats as we move to the closing segment. And I invite the speakers for the closing segment to take their seats at the podium. And thank you for your attention. Thank you.
We now begin the closing segment of the interactive multi-stakeholder hearing as part of the preparatory process toward high-level meeting on pandemic prevention, preparedness, and response. I'd like to express my appreciation to all participants for their invaluable insights and contributions to this meeting. I now give the floor to His Excellency Omar Hilale, Permanent Representative of Morocco and the co-facilitator of the preparatory process.
Thank you very much, dear Vice President and dear friends, Excellencies, colleagues, dear friends. Today's hearing was, as the Prince Zaid just said a few minutes ago, very rich, fruitful, and informative. And I would like to thank the Office of the President of the General Assembly for organizing this exchange. I commend the good work and commitments of the President of the General Assembly to ensure that stakeholders have an opportunity to be heard, to exchange, to put questions, but also to hear what has been said by different panelists and different co-facilitators. I listened very closely and carefully. And as the co-facilitator of the PPPR process, I am committed to ensuring that we hear from as many stakeholders as possible. My fellow co-facilitator and I have been doing just that. We had consultations with civil society, private sector, academia, think tanks, UN specialized agencies, and other partners, both in Geneva and in New York. I will be traveling to Geneva again to attend the World Health Assembly, and they plan on continuing my consultations with all stakeholders there. I look forward to seeing the summary of the discussion today and also reading the statements submitted by entities that regrettably did not have a chance to speak today. Their inputs will be very important to Gilad and I as we draft the political declaration. I want to reiterate something that my fellow co-facilitator and I have said many times. We aim for the political declaration to be negotiated by member states to achieve consensus, as stipulated in the modalities resolution, and we strive for it to be concise, action-oriented, with solid objectives to lend the highest level of political support to PPPR, and also to the negotiations in Geneva for the INB. We are of the view that the political declaration should reaffirm and strengthen the central role of WHO, which we should keep that in mind, is key to the global health architecture as enshrined in its constitution, as the directing and coordinating authority on international health work, including pandemic prevention, preparedness, and response. We aspire that the political declaration will lend support to the work of the INB and to the working group on the review of the international health regulations, and to commit to continuous harmonization and alignment between New York and Geneva in this regard. Thus, it needs to be highlighted that ongoing three processes are working toward a common goal, which is strengthening pandemic prevention, preparedness, and response so that the world does not suffer to the extent it did during COVID-19. Here in New York, we will work to generate the appropriate environment and the political support for the international community to be better prepared for the next pandemic. Our aim is not to reinvent the wheel or create duplicative or unnecessary mechanisms or processes. The tools are here. We just need to enable them. With this approach, we can contribute to strengthening pandemic prevention, preparedness, and response, and further strengthen and empower the World Health Organization to play its central role, to play the role it has been created for by the member states. The high-level meeting and political declaration should ensure that all member states are prepared for the next pandemic, and that the women and men on ground, community workers, researchers, scientists, teachers, and first responders delivering much-needed healthcare services are well provided with the support and tools needed to carry out their important work. Most importantly, we need to ensure together that member states get back on track to achieving all of the Sustainable Development Goals. And this is what we hope to do here in New York, and this is what we heard from you today and also yesterday. Today we heard from petitioners on the ground their experiences in responding to the COVID-19 pandemic and important lessons learned, which we must take to heart to end the cycle of panic and neglect. And it was very clear that we need whole of government, whole of society, and multi-sectoral approaches to be better prepared. Speakers were very clear and sometimes even loud, and we appreciate that. And we need a people-centered approach to prepare and respond better. with communities at the center as pandemics, being and end in communities. The need to address inequities could not be stressed more, not just in access to health services, including primary health care, but in all areas. We also heard from you about the importance of structural and financial investment that is transparent, regulated, and sustainable. It is also important to invest in human resources, in strengthening and protecting health workers. I want to pause here to pay tribute to them as they regularly put their lives on the line to help others. So I want to thank them deeply. We also heard from speakers about the importance of building capacity for vaccine manufacturing, in research and development, so that all countries are better prepared and we see genuine equity throughout the world. And very importantly, we heard about the importance of good governance and the need for leadership, accountability, and monitoring by all and at all levels. Combating mis- and disinformation is a key component in building trust and transparency among and between countries. We are all committed to the same goal, that we will never again experience what we have over the past few years. We owe it to the future generations and to the 7 million people we lost to COVID-19. Let us not lose the momentum and make the high-level meeting, which is in the first of its kind, a historical success, and the political declaration landmark roadmap, so that we are ready for the future. Not future of uncertainty and fears, but future of previsibility, a future full of hopes for everybody. I thank you very much.
I thank the permanent representative of Morocco. And I invite the Assembly to view the pre-recorded statement of His Excellency GA HLM, permanent representative of Israel to the United Nations and the co-facilitator of the preparatory process.
Friends, I regret not being with you today in person, and I thank the President of the General Assembly for facilitating this opportunity for me to speak with you virtually. The coronavirus pandemic has affected every aspect of our lives, and its impact will continue to be felt for years to come. We are not out of the woods yet with the coronavirus pandemic, and already we are seeing worrying trends concerning other pandemic threats. As a result, the General Assembly High-Level Meeting for Pandemic Prevention, Preparedness and Response is critical in harnessing political will to push our global efforts and accomplish our ambitious goals. In the last 3 years, humanity suffered greatly from this disease and many lives were lost. It is our shared responsibility to do everything in our power to better prepare for future pandemics. We owe it to our children. We owe it to future generations. The pandemic showed that national governments and the international system are ill-equipped to deal with the scale and complexity of health emergencies, including to address secondary impacts which require a multi-sectoral approach. When the pandemic struck, I was the Minister of Public Security of Israel. From my country's and my own experience, adopting a multi-sectoral approach was a key aspect that improved our response. From the beginning of the outbreak, we quickly understood that the government must focus its efforts on leading, coordinating, and bringing together all stakeholders among them health organizations, law enforcement agencies, social welfare experts, civil society, and more. Everyone joining forces to save lives. The pandemic has been one of the greatest global challenges in the history of the United Nations. It has caused an exacerbation of economic and social inequalities within and among countries, which is hampering progress towards achieving the 2030 Agenda for Sustainable Development and its goals. From my point of view so far, there were several important elements that were raised and must be addressed. Elements such as the One Health approach, antimicrobial resistance, governance, accountability, and equity. This hearing was an opportunity to discuss the experiences learned from the pandemic so we can better prepare for the future. A spotlight was given to the importance of a multi-sectoral engagement, one that goes beyond the health sector and is required at the global, regional, national, and local levels. There is a strong need for investments. We must avoid pandemic fatigue and keep this issue at the top of our priority list. Investing now will save lives and resources in the future. National capacities need to be developed, including strengthening health systems, building a stronger health workforce, investing in research and development, and of course, developing a broad management and response systems. In conclusion, the high-level meeting is a critical platform that aims to harness political will to push global efforts and accomplish our ambitious goals. As co-facilitators, we hear and will continue to engage with all stakeholders to ensure synergies across the three health-related processes of the General Assembly, as well as the negotiations in Geneva. We are certain that this hearing advances our efforts to ensure that the world is better prepared to handle future pandemics. Thank you.
I thank the permanent representative of Israel. The interactive multi-stakeholder hearing is now concluded. The meeting is adjourned.